It's always been a joy doing media talk because it brings it down to the basics of reproduction, how people make babies, and how making that baby can be difficult for several reasons. So we start by looking at how babies are made. It's easy. You go to your bedroom and lock the door, and then babies are made. However, first an egg has to be released, and then the sperm has to travel all the way to the end. It's always a longer journey for the man, isn't it? To get a woman. But after that, a lot is, once it's fertilized, it becomes called the embryo. And then it will go through various divisions until about the 5th day, when the blastocyst is formed. Then that is the stage that it implants into the womb. So any interruption of that process can lead to infertility. So infertility is taking us the failure of a couple to achieve a pregnancy after 1 year of unprotected intercourse. And we have two types, primary infertility or secondary. If pregnancy has never occurred, that's primary infertility. If the woman has had a pregnancy before, whether it ended in a baby or a miscarriage or a termination, it's still secondary infertility. In the developed world, in the United Kingdom, we have like 6% as the infertility rate. The US, about 10%. Sub-Saharan Africa, about 20 to 30%. And what are the causes? 40% of the time is purely because of the woman. Another 40 purely because of the man. 15% partially the man, partially the woman, and then 5% is unexplained. So if you look at those figures, it is shared equally between the man and the woman. So please don't blame the woman until you've checked yourself. In the developed countries, these are the causes, These are the causes of infertility: endometriosis, anovulation, for example, from polycystic ovary disease, hyperprolactinemia, premature ovarian factor, or cervical or endometrial factors. However, in the developing countries, you can see it's mostly due to sexually transmitted infections, post-abortal infections, or infection after having a child. The above lead to tubal blockage and peritubal adhesions. Sorry.
Have a mic.
Oh, it's moving too fast.
Okay.
Oh, okay. If I'm allowed to be slow, I can be slow so you digest it better. All right. At other presentations, they want me to go very fast. Okay. So, should I go over this particular slide? The previous slide, all right? All right. I'm sure it's this part. The causes of infertility may be different between developed and developing countries. Whilst in the developed countries, you have endometriosis, polycystic ovary disease, where the woman has more eggs than average, but is rather infertile. Hyperprolactinemia, where the prolactin hormone is too much in the blood, or premature ovarian failure. They are not yet that old, but they already don't have enough eggs, or cervical or endometrial factors. They may be the main causes of infertility in the developed world, with very little due to infections. However, in the developing countries, the emphasis is more on sexually transmitted diseases, post-abortal infections, puerperal infection, which is infection after delivery, which lead to tubal blockage or adhesions around the tubes. And why do we say that? Because there's proof. Because when they did studies and they checked the organisms in the pelvis of women, they found that infectious organisms were more common in infertile women compared with fertile women, which means infections in these cases was the higher reason why they were not getting pregnant or why they had the tubal abortions. Yeah, so these are adhesions. This is the womb. These are the tubes and the ovaries, but you have lots of spider web kind of findings in these women. The infections are associated with unsafe abortions leading to tubal blockage. Also, you can have what we call Asherman syndrome. When you have excessive DNC, curettage, after several miscarriages or abortion or terminations, and there's excessive curettage, cleaning of the tube of the womb, that can also lead to adhesions. The two walls stick together and make it difficult for you to get pregnant. We found that only few women in developed countries obtain care from trained personnel at delivery. A significant number deliver either at home or with a traditional birth attendant or in a clinic where, they may not have all the facilities. The majority still rely on traditional birth attendants or churches where non-sterile delivery procedures are practiced. For that reason, infections are still very high after delivery. Then, in many areas, they do not have facilities for cesarean section, for surgery easily. You have to be transported to another place. So they do their best to try and get you to deliver normally. In that process, we get obstructed labor in a lot of places. When they've waited many hours, then they get you into a vehicle and then transport you to another facility where you may have a cesarean. During that period, you have pelvic infection because you've had several examinations. Everybody is trying. The junior midwife calls the senior one, who then calls the overall. Every examination is pushing more infection up there. And then they end up with obstetric fistula, which may be urinary or fecal, and it's sequelae. Okay, what happens in this case is the head of the baby is pressing so low in the pelvic of the woman and is stuck. In between the head and the pubic bone is the bladder in front, and behind is the rectum. So because of the pressure being persistent for so long, there's no blood running through that part of the bladder or the rectum. After a while, because of lack of blood and pressure, that part dies, it becomes dead. So eventually, after this woman is given the cesarean, that dead tissue falls off, and then there's a hole between the bladder and the vagina. So this woman cannot control her urine outflow anymore. She's just leaking urine. Or if it happens at the back, she's leaking poo, feces. It's sad that this still happens in the third world today. Then other infections like tuberculosis and schistosomiasis may damage both the endometrium and the tubes, leading to infertility. Yes, tuberculosis endometritis is still one major factor in infertility, and I think India suffers this particular pathology quite significantly, but a lot is being done to eradicate it. Then, in parts of the world where female genital mutilation is practiced as a culture, we still find there's high incidence of infertility because this is normally done under very sterile, aseptic conditions. So this is where Merck Foundation, through its initiative, is pushing to disseminate the information to the whole world, particularly the third world, that infertility does not just affect women. About half of the causes of infertility are due to men. And it's one of the commonest conditions affecting the reproductive age group, that's the 20 to the 45 years. So we need to spread the information that we are getting from here. And we should support our wives when it comes to infertility. In fact, it's important that once your wife is not getting pregnant, start thinking, could it be me? It's amazing how once a woman gets pregnant, then the man feels he's fertile. There are many times that the man may be very poor, but because the woman is very fertile, he makes up for that man. Whilst the same man with another woman may not work. So sadly, it's the woman who has to get pregnant to indicate that the couple are fertile. I wished it was alternating. This year you get pregnant, next year the man gets pregnant. Then we'd see what happens. Let's go on. In the developed world, the most prominent causes of male infertility, yes, the topic said male infertility as well, but I combined it because the two has to be one for the results to come. So the most prominent causes of male fertility in the developed world include hypogonadotrophic hypogonadism as produced by tumors of functional failures in the pituitary and hypothalamic levels, and the hyperprolactinemia testicular. These are all big, big words. What does it mean? Okay. In both men and women, the actual start of control of production of sperm and eggs starts from the brain. And there are many parts of the brain. The biggest part is the hypothalamus. Then it goes to the pituitary before it comes to the ovaries or the testes. So things affecting the brain, severe stress, for instance, can affect your hypothalamus and therefore affect the hormones that will leave the hypothalamus to work on the pituitary. The pituitary is where the signal for production of sperm and egg take place. That's the follicle stimulating hormone. Both eggs and sperms are follicles, so their hormones come from the pituitary. So those are the kind of things, or testicular failure, that would affect the developed world. By contrast, in the sub-Saharan Africa, sexually transmitted diseases, especially gonorrhea, chlamydia, account for a significant proportion of cases. All right, let me see what the next slide will show. Sorry, the sperm is produced in the testes. Sperm production needs a lower temperature than egg production. So God in his wisdom put the testis outside the body in a little pouch so that that temperature will be a little lower than the body temperature. When it's produced, it goes up, it's stored here in the epididymis most of the time. Okay. So during arousal, then it is brought out into the vas deferens, goes around the bladder, through the prostate, and then it's ejaculated out. So any sexually transmitted infections will start from here through the penis and go back, cause infection in the prostate, go through the vas, may block the vas, or may cause epididymitis, or even the whole testicle may get infected. So anywhere along the line, sexually transmitted infections can reduce your sperm production or even block it completely. So in the, yeah, okay, so the updated slide tells you a little more. Environmental pollutions like toxins and certain lifestyle factors like excessive smoking, alcohol, or drug abuse can also affect sperm production, as well as obesity. When you are very fat, there are certain inflammatory processes that affect your sperm production. Yeah, so the infections like gonorrhea, chlamydia may cause chronic epididymitis. That's where the sperm is stored, or occlusion of the vas difference, leading to low sperm count or no sperms at all. Then in the male as well, certain viral infections like mumps, you find that there is a huge swelling. Normally it affects in the teenage years. It has different names in different cultures. And it's as if, at a certain stage, you would get that anyway. So some places they paint it white, draw things on it and all that. But that virus can travel into the testes and mess up your testes. You get testicular infection with the mumps virus, which will reduce your sperm production because the cells that are going to produce the sperms have been damaged. That is why we promote that all kids should have the MMR vaccine, that's measles, mumps, and rubella vaccine. It is a vaccine that will help the baby develop antibodies, so when they get exposed to the mumps virus, they do not get infertile at their later years. So that's infection prevention towards preventing infertility. And it's a measure that if it is instituted in a country, will reduce the risks of infertility in the future by reducing the risk of the men getting infertile from mumps infection. Okay, these are basic diagnosis, semen analysis, some hormone tests, genetic tests for chromosomal abnormalities, testicular biopsy or scrotal ultrasound, tests that you can do to investigate infertility. Yes, again, Merck's advocate. You should share the journey together with the woman, limit alcohol intake, avoid the use of drugs, stop smoking, share the responsibility. Talking about the temperature aspect of keeping the testes outside the body because it functions better. It's thought that those who expose themselves to very high temperatures can reduce their ability to have good sperms. For instance, if you always on the motorbike or have very tight pants or always having very hot baths, if you think it's taking your wife longer, start to think of some of these things and change them. Maybe you should have a cold shower and wear loose pants. What's the societal impact? is a major cause of marital disharmony in Africa, and it exposes the women especially to ostracization, social discrimination, and physical violence. You saw the initial clip of the woman losing both hands, even though it was the man's fault. And because of the pressure. How do we prevent it? Why is it so important? The major cause for infertility in sub-Saharan Africa is from pelvic infections in both male and women. So it's clear that a better approach to its management will be direct programs towards prevention at various levels. What about primary prevention? I said earlier that early childhood vaccination with the MMR is one of the ways we can start reducing that. Early orchidopexy of undescended testes, big words again. Orchidopexy just means repositioning the testes. Unfortunately, some boys are born without their testes out. That's undescended testes. If you don't bring them out in time, because they are left in there with the heat for a length of time, if it is discovered later, the sperm-producing cells may have been damaged. So it's important that all children are examined by the doctor early after birth, and that both testes are in the scrotum. Otherwise, the pediatric surgeon can bring them out and position them in the testes to prevent damage to the sperm-producing cells. Sexually transmitted infections should be treated. In fact, you should even be preventing them by educating the population for safe sex, using of condoms, sticking to one or fewer partners, then post-abortal infections. There's the promotion of safe abortions is going on in most places. It depends on where you come from, whether you have legislation or not. But no matter what you do, people are going to have abortions done somewhere or the other, but how to manage it after that is very important. Post-delivery infections, as much as possible, we should be disseminating that our governments try and provide more basic health facilities so that our women, no matter where they are, can have a safe, decent place to deliver without getting infections. Yes, so community education and behavioral change, modification on sexual practices, effective contraception, including barrier methods, both male and female condoms reduce the risk of infectious organisms. And when contraception is also promoted, it would prevent unwanted pregnancies that would lead to unsafe abortions. So you cascade the reduction of infertility. Similar provision of effective maternal care services will reduce post-delivery infections. Secondary level of prevention would be the early recognition and aggressive treatment of sexually transmitted infections and prompt treatment of post-abortal and puerperal sepsis to prevent future infertility. Yes, once you suspect that there is a sexually transmitted infection, try and get to a good doctor to get a good treatment. Don't go to some chemist and just buy some antibiotic and you think you have a relief, but for all you know, it's not properly treated. It becomes chronic, and before you can get help, it's already late. So get prompt treatment. Yeah, so go to a health facility and don't self-medicate. Then the tertiary level is to use methods to mitigate the effects of infertility in couples, including systematic counseling with conventional methods. Where cost is not a problem, use one of the newer reproductive techniques. Where infertility is irreversible. Okay, so with this, it means when the couple have been found to have infections that are making it difficult for them or other reasons, then you may need to move to assisted reproduction if cost is not an issue. We know that worldwide, assisted reproduction like IVF is expensive because of the inputs and how technically challenging the whole procedure is. The WHO is currently working on a low-cost IVF, which hopefully next year it should be rolled out to see if that can bridge the gap between those who cannot afford the current IVF process. And when all that fails, because even the assisted reproduction is not 100%, there are many times that whatever you do still doesn't work. There are still options. You can counsel the couple to accept their fate that they might never have children themselves, and therefore they should consider adoption or fostering. These are the options of the assisted conception, controlled ovarian stimulation with timed intercourse. The infertility challenge can be at different levels. For some people, all you need to do is put them on medication and tell them when to expect the egg to be released and to have intercourse, and that may be all they would need. For another, you may need to bring them in when the egg is ready and released, because maybe the man's sperms are so poor, speed of movement is so slow. You then do sperm preparation and then do an insemination, like give the lift to the sperm and put it right in the womb near the tube to make meeting the egg much faster. With others, you may need to bring the egg out and add the sperm, which is the IVF or in vitro fertilization. In vitro fertilization just means outside the body fertilization. In vivo fertilization is what happens normally when a man and a woman meet in their bedroom and the sperms meet inside the body. When you bring it outside, it's in vitro, it's just Latin. Intracytoplasmic sperm injection is an advanced form of IVF. With standard IVF, once you bring the egg out, you bring the sperm out, you put them together in a dish, the sperm will fertilize the egg. But when IVF was started, it was found that men with low sperm count didn't do well with IVF because the sperms were so few and so weak, they couldn't break the shell of the egg and get in. That was when intracytoplasmic sperm injection, or cut for short, ICSI or ICSI, was developed. With that, all you need is a single sperm injected into the egg. And once it got in, the two DNAs will come together and fertilization rate was very high. So this is normally used for men with low sperm count or men with no sperms at all, when you need to get into the testis to hunt for sperms. And when you bring them out, they are so few that it's not now you do an IVF, conventional IVF, because for conventional IVF, you need like 50 to 100,000 sperms per egg. For intracytoplasmic sperm injection, you need 1-to-1. So it's very helpful then. Yeah, that's the testicular sperm collection, because there are people who have had infection and that tube that transmits the sperm from the testis through the penis is blocked. But when you get into the testis, you can find sperm. So you do this surgical sperm collection and then inject it into the egg. Then you have gamete donation, where the woman doesn't have eggs or the man doesn't have sperm, but they want to have a child. You can have either sperms or eggs donated, and you can still help them to have fertilization, and then the woman gets pregnant and they still have a baby. And that has actually revolutionized the assisted reproduction so much, because since the advent of that, many couples who otherwise would not have had children now have children. I always say that many times it's very difficult for a couple to have children. So much pressure that you find that the man, it's not that he doesn't love the woman, but he wants a baby in the house, or to prove his maleness, finds himself drifting to this other woman and gets a child outside the relationship, just out of pressure. The woman loves the man and decides, okay, it's my fault, I'm not getting pregnant, so I will accept it. But invariably, you find that that kid was born outside and needs that mother as well. So they accept that the kid should stay with that extramarital affair. What happens? The father has to check on his son or daughter. And whenever he goes there, there's a nice meal prepared. Maybe there's a glass of wine. And before you realize, number 2 is on the way. In the meantime, if that egg could have been brought home, fertilized with the man's sperm, and his wife will carry it, and she's pregnant with the man's sperm, she is the one who has nurtured that blastocyst. When I showed you that diagram, at the stage of the blastocyst is the final stage. This baby, let's call it baby, 5-day-old fertilized embryo can survive. After that, it would hatch and die if it doesn't find the lining of the womb to implant. So when we are going to do any freezing of embryos, it must be frozen at the blastocyst stage. Beyond that, you lose it. So this woman is going to feed it with all the nutrition, the oxygen, the everything, to convert it from an embryo into a baby in 9 months. All right? The whole society has seen her pregnant. Whether it's her egg or it's not her egg, it's none of your business. She's pregnant for the husband, and it's in that home. It keeps families together. And therefore, I think gamete donation is keeping society more sane than otherwise. Then you go to surrogacy, where a woman may not be able to carry a child because of several reasons. Either she doesn't have a womb, or she has a womb, but she's gotten pregnant 6, 7 times and lost all because there's something with her that she can't keep this pregnancy to 9 months? Or other reasons. She had cancer at a young age and they had to remove the womb. But she still has ovaries that have viable eggs in them. At this point, you can get another woman to carry an embryo, which is the woman's eggs fertilized by the husband's sperm, and then she does the carrying of that baby for the 9 months and delivers it for the couple. That's surrogacy. Or adoption, where it is not their biological child, either of them, but they have accepted to bring this child to their home as their own and look after it as a family. Public awareness and health education is very important. There the media goes again. Besides the negative impact that HIV may have on your body's immunity, it can also affect your body's ability to produce hormones and fall pregnant, and may also lead to early menopause. So where we talk about prevention of disease, this is one of the results. Chlamydia and gonorrhea. Yes. Chlamydia, for instance, unlike gonorrhea that will give you maybe an offensive discharge, a lot of pain, fever, and all that, chlamydia usually causes no symptoms at all, but causes a lot of damage. So it must be looked for. Left untreated, this silent infection can cause pelvic inflammatory disease. Safe sex, we've spoke about that already. Tobacco has negative effects. Secondary smoking is when the other party is not a smoker but inhales a lot of that smoke. That can also affect your fertility. Yes, eating a balanced diet, maintaining a good weight, choice of food, and regular exercise. With women, if you are overweight or underweight, that can affect your hormone production and will result in disturbances of your periods and cause infertility. They talk about caffeine. So what are the key points to take home? Yeah. Infertility is not a stigma. It can affect any couple. Half of the time is from the man. And so check both partners and go on the journey together. Yes, affects men and women equally. Get informed. That's why I always like my time with the media, because they disseminate information, and it's amazing how important questions are asked by the media. Support your wife. It's a shared responsibility. Thank you.
Thank you very much for this opportunity given by Merck Foundation. I'm very grateful to have your attention. As Health Media Group, really, we are very delighted for Merck Foundation to make us work together to create a difference. It's really a good opportunity for everybody globally in regard to management of infertility. I'm Dr. David once again, working from Rwanda. I'm glad to be in front of you. As media group, anyone from? Great. hopefully they are following us online, which is great. Really, infertility is a challenge, and most of the information in regard to management option has really been given by my senior doctor, and really it's not easy to present at this time towards lunch. Many of you, I see there, some who are fatigued. Could we stand up a bit and stretch up our arms for a few minutes? Yeah, even those who are following us online, maybe. Yeah, very great. So really, you're going to answer for me a quick question, one by one, and you sit down. So, so really, I want to share with you. I want to everybody. We're gonna be interactive session. So really, I want to give me some information in regard to our society. Like, what does our society, like, what in our society, what does like infertility lead to? For example, you have friends, families. What does our society infertility lead to, for example? Yes, my colleague? The infertility leads to in our society, families. Can I have, Caesar? Just one.
Okay. You are not a real woman, and you no need to be in the marriage, maybe in a relationship. You can't produce anything.
Yes.
Divorce.
Okay. Thank you. You can have a seat. Next, what does
Ridicule. Ready to discrimination.
Good. You can sit down, all of you. Okay. Another?
You want to hear the question?
You
Suffering.
Pardon?
Suffering.
Pardon?
You
Suffering.
suffer.
Oh, good.
Like social discrimination.
Next. Next.
Okay, what it leads to? You mean,
Yes. In our
infertility?
society. Yes.
In our society,
Yes, please.
so some couples they get separated.
Separate, divorce.
Yeah.
Good. Don't repeat your neighbor's answer. Yes.
I can speak in French.
Yes.
Donc ça conduit à la discrimination au sein de la famille.
C'est ça. Yes. Next.
Stigma.
Stigma.
Yes.
Yes, please. Yes.
Polygamy.
Polygamy. Very nice.
Speak Portuguese. Sorry?
You speak Portuguese.
Yeah, yes,
Quick,
yes.
que question.
Yeah.
Anything.
Bom, good morning, bonjour, bom dia. De facto, a comunicação é interessante, mas eu também estou na mesma perspectiva aqui da minha colega, polygamy.
Polygamy. Yes.
Yeah.
Good.
It causes stress and mental issues.
Very good. Nice.
Yeah.
So the rest of the group, excuse me.
Can you repeat the question for this lady?
The question is, why does infertility leads to in our societies?
What it leads to?
Yes.
It breaks families. If two people get married and they are not able to give birth,
Yes, divorce.
That's basically, yeah.
Yes. As from the health media group, you're a very, very important group in our society. You're gonna address this issue of infertility. So we're gonna work together. The first thing is that let's identify each other in your countries where you're coming from. Let's work with the clinician. I know most of you, how many have IVF centers in your home area? Great. But those who don't have these centers for IVF, still, there are options treatment option. When we talk of management option, it's not about IVF. It's not about IVF. You can see that our society, Africa, even where I come from, the society have different misconception about management. You understand? Yes. So really, as I'm summarizing for those following us online, we find that, as you've said, really, all of you are right. You find that in our society, in fact, it leads to psychological distress, which is going to be addressed by my colleague, marital conflicts, stigmatization, domestic violence, encourage risk sexual behavior, whereby they're going to have so many wives because they're looking for, like, children, or divorce. Really, this is a big issue. And also, we have to understand, as media group, what does our society think about that causes infertility? If you don't know what our society thinks about it, we shall not also, as clinicians, achieve the solution for it. So many of you talked of the witchcraft. Actually, this is a big issue in Africa. You understand? Other think that when they were on the wedding, somebody give a gift. Other think that in a wedding, somebody touched. You understand? So please, as a media group, thanks to Merck Foundation, really bring up this issue. As the media group, you play a very important group in solving this issue. You know, as clinicians, we are always busy there treating, but we must inform our society. Other thing is the spiritual forces. You understand? So, failure to adhere to cultural taboos. Other thing that, oh, you're in civilized society, you're behaving like this. You never, once you visit your home area, like towards the festival season, the older people will tell you, oh, you don't come home, you don't dress like us, maybe the cause, so you try to take the herbs. This is also happening in Asia, by the way. Herbs. Maybe it is God's will. You find that the church is telling you to pray. And when you encroach 50 years, you stand out to come to the clinician, I want to deliver. Yet you spend 20 years, you're praying to God. So as the media person, please address this issue. I know that age is really a very important issue. Do you know that as a media group? Yeah, my senior has told you that the good age for conception is really before how many years?
20 to 35.
Yes, 20 to 35. Please address our society. Praying is very nice, but please pray as you come for treatment. This is a very big issue that as my sister will be trained, people really are in prayers. You get married at the age of 20, and you're not in prayers. Prayers work, but really prayers work with our clinical setting. I always tell my patients that really God works through people, and the devil also works through people. So God can work through us as clinicians. You understand? Yeah. Not approaching witchcraft only. So really, I was emphasizing that. Also, people think that not conceiving is through pattern incompatibility. Really, this is really a big issue. Even the educated one, they think that if you have blood group O negative, or if you have blood group O positive, that your blood is not compatible. Oh, let me go and try to another partner. Maybe you come compatible. This is nonsense. Really, does not work. You don't have to have different blood group, because God created man and a woman. Really, it's not about the blood group. We are all human beings, and when we meet, we must reproduce. But our society, even those ones that educated, they think that blood group difference does not allow you to produce. You are a human species. Wherever you're black, white, you're married, you must reproduce. This is not the cause. This is really a big issue. As the media group, please, we need to address this together. So others think maybe you get married, and other think that abortions. The first thing, if a man marries a woman, they think, oh, this lady, maybe she's educated, she aborted, she used family planning, she will not produce. This is not true. As a media group, this is the first thing that you go and address. It's not about that you committed abortion. As the my senior said, abortion, no, infertility is like, a woman is not really to be blamed. It's not really, you shouldn't be victimized. No, taking long to conceive is a disease like any other disease. You don't have to blame each other that you use family plan, you went to abortion. Really, as a media group, we call upon your participation and identifying us. As Merck Foundation has really tried to make us work as a group to maintain the good outcome. So, yeah, as I said, abortion contraceptive is not true. So really, before we think of fertility management option, you must know what our society really is think about as the professionals. You're gonna, take into account this. So with the slide, I'm not going to delay much for your time because almost it's lunch hours. Really all the things we've been speaking, like as a media group, to anatomy, physiology. I'm gonna not delay into these slides because anatomy, physiology, female causes or the male causes, basic of treatment. Most of these have been said by my senior. I'll only embark on the take-home messages. So, what you understand in treatment options, you as a professional from media group, you understand that really we have, God made us in a way that a woman should be made, a man should be made. And these parts of the body should be functioning. The womb from the woman, the male, the testicles, all these, God made them to function. And wherever there's a problem, we as clinicians, we are there to solve them. So my senior talked about really how the anatomy of a male. I will not say about it, but all these parts of the male, they can have problems. So we are there as clinicians to solve them, to know where's the problem. Is it from the testicles? Is it from the exit of the sperm? Is it from erectile dysfunction? What is it? Look at the anatomy, the creation from the woman. Anything can happen from the vagina. Anything can happen from the ovary. Yeah, and there can be either problem from the vagina. Maybe it's not open. Things may not come from the uterus. Problem may be here. So we are there really to address the issue. You don't have to know this or the anatomy so much as people from the media group, but know that once these parts of the body are not functioning, they can lead to infertility. How is the baby conceived? This has been talked. You don't have to bother yourself so much with you're not medical professionals, but you should know that really fertilization comes from immediate after here. Sperms are deposited here. The sperm have to move to the fallopian tube, and they have to meet the egg. All these can have problems. You can have problem from here, from the vagina. You can have problems from the uterus. All sperms cannot move. All this really is a complicated science, which you don't have to master much, but tell our society, the message to the society, that really something has to be done. Investigation has to be done to the doctor, and they found out. It's not about witchcraft. It's not about spiritual. All those really tell people to come. And really, I advocate you to approach your centers, your doctors. Please approach them. You work as a group. Let us inform you all the stages where to tell the public. We shall not delay about this. My colleague talked about it. So causes of infertility, male, female, unexplained. Oh, these are there. So I will not delay much, but treatment are always there. There are treatment for male, treatment for female. Really, I'm telling you as a media group that treatment are there, and please come and approach us to which country you come from. Those following online, please approach your clinician, and really let's work together as Merck Foundation alumni. We shall teach you on the ground, and we shall inform you how to inform the public, and we shall achieve our target as to bring the infertility couples, the issue addressed, to see really the problem they are facing, and really we bring the infertility or stigma on the table, and we inform the policymakers in our countries we come from. So much has been said, and you know, when it comes to treatment, these slides, we shall share more of this slide, and please, I said, approach your clinician in your country and get to learn more what to tell the public. So this is an introduction part, but you know, our patients, they first go to witchcraft, they first go to spiritual, they pray for them, they sell their beds. Some they tell them that, please sell your bedroom. Maybe they came and dropped in there. You know much about that. But please, this is a misconception about infertility. Age, as I told you, is the most worrying factor. Because when you tell the population, our community, we gonna, some ladies, they think that, oh, I'm still praying, I'm still serving God. When I reach at 50 years, that's when you get married. Yet there are some guys who are proposing them at age of 25, and they're saying, I'm still praying to God. No, please, let's also know that at age of 50, when you come, either you decide to donate the egg, or maybe if you have money and you want to go to age of 50, you can keep your eggs, you can preserve your eggs and go work for God. Then you reach the age of 50, let your eggs be, be brought from the freezer, from the egg bank. Then you can now come for delivery. You understand? This is the information that our community needs to know, that you can keep eggs, you can, from being spoiled by your body, all these things you have to inform the society. So thank you so much. Really, I will not drill to delay much, but please, I think we should thank Merck Foundation, because it's tried to bring you closer to us, really. And I didn't know actually myself how the big role you can play to us, but I'm coming to realize that really we can work together as a health media group to create a difference in our society. Please, thank you very much. Take home message, please identify your clinician in your home area, and let's work together to create a difference. Thank you so much.
Good afternoon, everyone. How are we doing? I was in another side room, conference room, and I got carried away. The discussion there was also pretty interesting. Thank God for Dr. David, who gave me a text. All right, great. So I think I won't take time to go into the description of what infertility is. I believe the doctors before me and professors before me have already done that. So I'll just be highlighting certain components of it. So what is key, which I believe is already being communicated, is that there's actually treatment around that. So when we talk about the treatment, it's not enough to just have physical treatment around it, but there's also the psychological, the mental health treatment around it. So for me, that is what will be my emphasis this afternoon. And it affects a lot of people. And I think even the previous speaker was mentioning that it's possible the statistics that we have are nothing close to what's on the ground, especially in Africa, because few people will actually go seek help for it. Few people will actually open up about it. They'll most likely isolate themselves from society, from family, and they don't reach out, in short. And of course, there are challenges as well around it. And I think, for me, one of the greatest challenges is when people actually lack knowledge. Because they don't know anything about it. So that's why you, the team, come in very handy. You've got a very key role to communicate to the public, first about what is infertility to start with, what causes it, how can you seek help for it, and how can you get support through this journey. And a big component as well is our attitude or perception about it. Again, you have an important role in that, because we're in a social media era. So you have this platform to influence things in a very positive way. Misconceptions like, oh, African Asians, they're a lot, they don't have any fertility issue. I think one of the myths that came up was that the poor or the less wealthy don't have fertility issues. That's far from the truth. The only difference is they hide it well and they don't seek any help for it, and maybe for some, they don't even know that they can seek help for it, and for others, they can't afford it. But otherwise, it cuts across the globe. So I won't go into the causes as I mentioned, but also maybe just to emphasize as well is that when we talk of infertility, it's part of health. You know, again, allow me to just ride on the WHO definition of health. When we talk of health, we're not only talking about physical health. Health is both the physical aspect and the mental health aspect. And again, it's not an absence of a disease or a disorder or illness. That's why even as we are communicating around infertility, it's important to highlight the social aspect of it, the cognitive aspect. How is this woman thinking? What is going through her mind? What is she experiencing emotionally? How does she feel through this journey? And our role is to build empathy, rather than the stigma that they face, rather than all the challenges that they face because of infertility. Very key for you, the media team, is to communicate things in a way that we change society's perception and attitude towards women who are actually experiencing infertility, because they go through a lot of stress. And again, I know I tend to be focusing as if I'm just talking about women. Actually, it's both ways. Even the men. Just a few hours ago, we were discussing it in another conference room. When it comes to the men, it's even worse. I don't know if any of you has ever had an opportunity to speak with a man who seems to be having some issues, or he's being investigated around his fertility. Women were good at expressing ourselves, but for the men, it's really bad. And especially in our culture. First one, it's such a new thing for a man to actually feel like I could be part of the cause. Because naturally, a lot of times it would just be like, oh, it's the woman, full stop, close. Even when asked to come to the health facility with the wife or the partner, it's like, me, coming to do what? Worse if now they have to start investigating, and then they say, oh, there could be something there. Then, very interesting in our culture, again, both African and Asian, the men don't talk. The men don't usually express themselves. So now he's dealing with all that inside. What do we think can possibly come out of that? Depression, but even beyond depression, that's where we see various negative social impacts from violence, stigma, gender-based violence, aggressiveness, alcohol and substance abuse, and people are wondering what's happening with this man. And these as well don't just end with the men. Even with the women, we still see that as well. Of course, for the women, a lot of times, as a doctor in my practice, you'll find it's more of depression, anxiety. It's just that the males tend, personally, the way I've observed it, they tend to express it differently. So a lot of things come up, and let us see how we help our people. Others, they could actually find themselves to some help that could help them get their fertility. For others, even if they don't get the fertility the way that they initially imagined it to be, we could still help them get some help to cope with what they're experiencing. So for me, I think I'll speak about various aspects of the nation. When it comes to infertility, I'll touch on gender-based violence, female genital mutilation. I'll just have like, I'll just go around, touch a bit on everything. So when it comes to gender-based violence, I think we've all been privileged to listen to the Linda story and the video that Merck Foundation has done. And a lot of times when people look at that, it's like, that was quite extreme. But that's what is happening in homes. And when we talk about abuse, again, another focus is usually just on physical abuse, but there's also emotional abuse. You find that the partner or the spouse who's having fertility challenges will have a lot of emotional abuse from their partner, from their family, from in-laws, and just community in general. And that also has a lot of potential to cause so much harm. Just because we can't see it physically, it doesn't mean it's not there. So let's see how we help our people. So gender-based violence involves, I don't think this has been something, I know the media are experts now when it comes to gender-based violence. We've spoken a lot about it, and I think we are making headway, I think, in general as a globe. But I think we still have a lot of room, especially in our African context. So again, I was trying to emphasize the emotional harm, right? Because I think a lot of times when it's physical harm, everyone can see it, everyone is quick to react about it. What about mental harm, verbal abuse, emotional abuse? Are we looking into that? Economic harm, economic manipulation. Let's give an example. This is a couple. They were happy together 2 years into marriage. The man used to spoil her, holidays, clothes, dressing up nicely. The baby is not coming. All those cuts. No more financing. It's like you're now a burden. Are we following how that can play itself? And that's why we need to communicate to the public. Whereas the person gets a concubine or second partner, whichever way you want to put it, then now all the resources are going. That, hey, I avoided using the word side chick, but since you said it, I can repeat it after you. It goes to the side chick. So are we seeing how it plays out? So even for you as the media team, it's important to highlight all these components. It's good we've been focusing on physical violence, abuse, and because it can actually lead to physical death, but even all this emotional, mental abuse can lead to death. People become depressed, they commit suicide. We keep hearing there's been an increased reporting of suicides on social media. I don't know about for you, but in my country, it has been that way. But I think in general, even the whole globe, actually. So it's important that we highlight all these various components so that we make people understand. We speak to families, hey, let's not speak ill to this woman or to this man when they're going through this. You know? Others, you find it's some form of abuse in the sense that they neglect the person. So they're still together. Yes, I give them the card. Are we listening? But no emotional, like the person is literally neglected by the spouse, partner, their family, in-laws. They're really an outsider, just observing from the outside. What do you expect to such a person with time? So even these other presentations actually lead to death. The death may come differently, may present itself differently, but it's still the outcome in the end. So, child marriages. Again, we are highlighting child marriages because these child marriages have got a potential to cause so much harm. I'll try and give an example maybe in here. At least I know all of us are above 18 from my general scanning. So by 18, you'd have had at least one breakup or so, or two. By 2025, you would have had maybe 3, 4, plus minus. Everyone has their different journey. And so a lot of us can already appreciate that as one matures, there's a certain level or capacity to handle certain things, certain stresses. But now imagine you give someone who's 13, 14 years old to handle certain stresses. For those of us who are parents, having a child, delivering, that period, taking care of another lovely human being. Those of us who have nieces, nephews around. I'm sure all of us have had a chance to interact with a child or someone who has a child and just observe that. Now imagine putting such a responsibility on someone who's 13, 14, 15 years old. Are we following? So my aim is just to bring it down and just hopefully by the time I'm done, you just have this perception of really being empathetic and really seeing things from the other person. So that even in our communication as media houses or platforms, we should be able to bring out those things. There's something that I think is usually said, to say, sometimes when you're selling something, this is really selling a message, right? You need to get the heart of it. And you're the media people who tend to teach us about it. But I don't see a lot of heart out there. The statistics are good, excellent. We actually have very few lived experiences that we see on the media houses. If you can get those, excellent. Because what you want to do is to buy the heart. A lot of times even the reportings that I see is more legal aspect. Oh no, this person did this. Hey, they have to go to prison. Hey, you know, it's very, that's okay, that's good as well, because it brings up an aspect of crime, great. But what about getting to buy people, to buy them in, you know, the heart of it? I'm not seeing a lot of that around. And we're human beings. Everyone, once a heart is there's a word, there's a term, a phrase I'm trying to get, but my brain is just foggy. but you get what I'm trying to say, right? Not a broken heart, like to buy in, like you buy your heart, like you win my heart over something. Yeah, I think it's more winning one's heart over something. All right, great. So, child marriages again. How are we communicating that? The statistics are very good. And I think as Dr. David was saying, please bring experts on board. Even as you are communicating this thing, it's good you do your research, excellent. And we know media houses, I think sometimes it's okay to call a specialist in that area, you discuss with them before you come up with a piece that you want to share, or you even have them on the platform to clarify certain aspects. At least that I'm seeing more of that in general, which is excellent, and I think if we can do more of that. So again, when it comes to Eastern and Southern Africa, about 27%. 27% by the age of 18. Are we seeing what is happening to our females? before they even get a chance to apply themselves at life, they're dealing with certain stress that in general is too much for them at that point. There's something else that they could be using their energy, their creativity, their passion for. So these girls' rights are violated. It increases a lot of health risks to these ladies, both physical and mental risks. Again, when we speak about these child marriages, a lot of them, they're sexual abuses, right? Or certain interactions whereby they can't even protect themselves. So again, it feeds into sexually transmitted infections, infertilities, you know, it's a whole vicious cycle. So even as we are reporting around infertility and all these presentations, let us have a whole rounded view around it, and let us highlight various aspects that are actually affected by these presentations. So HIV, childbirth, violence. Let's say this young lady is maybe say 15, and the person who's impregnated is 24, 25. The high chances of this person being exposed to other abuses compared to someone who's mature. Take, for example, at my age, there's a form of defense that I can have, which they will not have. So the risks increase, various risk factors as well come in. Domestic violence, economic and social abuse potential is higher, because most likely that person doesn't have a source of income, so they have to be dependent on the other person. So another issue we'd like to highlight is female genital mutilation. Another very sad practice. For lack of a better word, chauvinistic. So again, I think that again is in a background of sexual pleasure is just maybe for one sex compared to the other. How? And it's like the other partner is just for reproduction. But how? It's more than just reproduction, right? Even the creator created it in a way that it's enjoyable, so that it motivates you to procreate. It's like eating. Why is eating enjoyable? Those are primitive aspects. I know I'll simplify the science. So things like eating, sex, even some exercise. So things which are supposed to be good for us are in a certain part of our brain. They highlight a certain part of our brain which makes them enjoyable so that you keep doing them. And for me, when I look at it, I think the maker or creator was just clever. It's like, okay, I want you to multiply, let sex be enjoyable. You need food for fuel, let eating be enjoyable, so that you keep doing it. So why do we want to deny one partner of that? So it becomes like a chore. But again, despite that psychological mental health component, where one is denied enjoyment or relaxation from the activity, because sex comes with so many benefits as well, ideally. So one is denied of all that. Yeah. I'm yet to come across someone who's experienced that. I haven't, at least not in my country, but I've read a lot around it, especially in East Africa, in West Africa. I think I've read around it. I just feel it must be a very sad practice. In Kenya, yeah. It must be a very sad practice. And you know, these are things that people are a bit reluctant to report on, and they may seem small, but they're very significant. They are significant. And we need to highlight these aspects. I know in our culture sometimes talking about sex is a bit, you know, but there are ways, you know, you have the brains around media and communication. There are ways I think you could still highlight the impact. Because even other than the social, of course, me, I'm focusing on the mental health presentation of it. But there's also the physical component of it. It comes with so many other medical risks physically as well. So again, I think this is just like an indication. Again, if you're not seeing, most of the countries are up, east, west, and north. I haven't heard much of it personally in the South, but yeah. So there's the social and psychological impact of it as well. So we need to speak around it, especially for infertility. I know someone just recently, for the past, I think, 3 or 4 months, they were recently married. That's their only stress, because they're not seeing a bump. And every time they speak with me, my advice is the same. Enjoy, you just got married, relax. This stress is what's preventing that baby from sitting there. But they are so anxious. The mother-in-law is greeting. So when is that one showing up? Everyone you meet along the way is asking the same question. Now that stress is even preventing that baby from sitting there. So these are subtle things that we could communicate, so that we're not only speaking to the woman who's having the infertility challenge, but we're speaking to also everyone around this couple or individuals. Even the men, it stresses them. Because now the mother will be asking him that, madam, what is it? You people are not happy. You're not enjoying. It's like, what sort of questions are these? So even in our approach of communication, let's highlight these aspects, because those are the things which actually cause the most stress. Even if they say it laughing, jokingly, no, the communication is still the same. Hey, so when are those babies coming? They're laughing. No, it's not funny. It's actually something very sensitive for the couple, actually not only the woman, for both a lot of times. Because when the woman is not showing, it also affects the male partner. Because that pressure as well is coming. Sometimes when I'm around the men, they'll joke, right? Eat peanuts, do this, hey, what's happening? Are you keeping her happy? Is everything okay, you know? Even amongst the men, it's a talk which is kind of belittled, but they actually really affect people mentally. So these are also some areas that we can speak into when we're talking to the public. So the hope is that when we normalize such talks, we're going to see a reduced stigma towards such individuals, even empathy from the public towards individuals who are experiencing that. Let me give an example. When I say someone had a stroke, what's your image, or how do you feel about that person? You feel sorry for them, right? You're empathetic. Like, oh my, the person had a stroke, right? It's because it has been communicated to us a certain way. So we're empathetic, like, oh no, so they won't go to work. Oh, ish, we hope they'll recover from the stroke. Hope everything will go well. Hope they'll be able to walk again, you know? But infertility, what happens? All the negative thoughts. I don't think the thought of empathy even comes in. It's like, hey, what could have caused it? All the thoughts that are running are a certain direction. Most of them are pessimistic, accusatory, more of investigative. What is causing this? It's not empathetic to say, oh my, the couple must be feeling this tension, you know, of what they're experiencing right now. So we want you to help guide the public on this perception change towards infertility. So there's a lot of fear, anxiety, a lot of guilt, grief. Let's give an example. Maybe it's even true. Maybe this woman had once committed an abortion at some point, you know, for whatever reason. Imagine the guilt that would be eating them. Now, maybe 4 or 5 years later, they are married and that pregnancy is not coming. Can you imagine what that individual is feeling in that moment? Yes, the mistake they made or the decision they made at that point, but how do we help this individual going forward? So there's a lot of grief, depression, anxiety, others even suicidal. Alcohol and substance abuse disorders start coming in because people are trying to find ways to cope. Their self-esteem goes down. And you know, there's also a cost to these fertility treatments, which we can't get away from, which also become an extra stress to the presentation. I've already spent $1,000, $2,000, $3,000, $4,000. This thing has to work. Even if they're going for fertility treatment, then it doesn't. They're anxious, waiting for 2 weeks, 1 month to confirm, has it settled well? No, it wasn't successful. The stress of saying you have to now go look for more money, and I don't know, are you following? So we need to communicate these other aspects around this presentation so that people could actually be empathetic towards these individuals. Then, I think I've already been speaking towards the role of the media. I think I've been highlighting those components. So your role is great. Create awareness, the right awareness. I'll emphasize again, the right awareness. The right buy-in. Guide on services available, you know? Other people don't even know that the service is available. We take things for granted because we know, but a lot of people out there don't know. So let's be solution-oriented as media houses. Let's give positive news. You know, I keep telling that even back home sometimes at media houses, they're reporting something and they miss the whole idea of the report. I'm like, you called us as a facility talking about this. The hope was that you highlight a positive message to the public. Good reporting is not always negative reporting. You can report in a solution-oriented manner as much as you are highlighting the challenge. But I don't know what's happening, especially on the African continent. People feel negative, bad reporting isn't reporting. No, you can report the same thing, but in a very cool way. Great. So advocacy, lobbying, that's a great role that you have to play as well. You speak for the voiceless. When you look at what is going through your mind, anything nice, anything positive? No. Negative? Nothing. This type of media, I know it seems attractive, right? These are the things I'm speaking into. Yes, it gets your attention, but what type of attention is it? Dark, negative. So we're adding to the stigma. And of course, for someone who's like, this is good media. Oh, for me, I wouldn't really think it's good media. It's negative media. So you're just adding to the stigma, adding to people. So let us be, thank you.
Okay, my name is Moshin Siddhartha. I'm from Mozambique. I'm Eduardo Monlan in Mozambique. And I'm very pleased and honored to be here. And many thanks also for the Merck team to help me set up the presenting. Okay, next slide, please. Thank you. Thank you very much. Diabetes, hypertension, they are silent diseases. If you don't check it, you don't know you have it. Okay? So for example, if we are a population, imagine we are a population, whether a village or province or country. If we never checked our blood pressure or our sugar level in our blood, we will not know if it's normal or if it's high. Yes? So, and these are silent diseases because they also, at the initial stages particularly, they don't have manifestations. And even when they have manifestations, they can be confused with anything. So to suspect of hypertension and high blood pressure or diabetes, it has to be both side effort. From us, looking to check, and from the health professional to check it. So I'll be talking a little bit about this because media has a great role to play, particularly in raising awareness. So we'll be talking about promoting healthy lifestyles and raising awareness. I will give you some, what are the risk factors and what is diabetes, what are risk factors, what are the complications and why it's important to talk about it. Similarly, we'll talk about high blood pressure. Okay? Non-communicable disease, this is a terminology that we use for all diseases that are not transmitted by microbes, by infectious pathogens, right? So it's like opposite name. We used to have communicable diseases which are transmitted by pathogens, by microbes. So when this group of diseases start emerging and start becoming predominant, the terminology was used to classify a group of diseases that are not transmitted by pathogens. So this group of diseases, non-communicable, because they are not transmissible, in the sense they don't pass from one person to another person, as germs pass in that sense, includes a group of diseases such as cardiovascular diseases, diabetes, cancer, chronic respiratory disease, and many others. These are the most common, that's why we always talk about them, okay? Why they happen, they happen because of different factors. There are factors that are related to individuals, including like genetic factors or like physiological factors, the way our human body functions. But there are factors also related to environment or related to our behavior, particularly lifestyle we adopt. Okay? It also can contribute. And you have noticed that the songs, etc., they keep talking about changing our lifestyle. Actually, Dr. Rasha also mentioned that lifestyle change has great impact in promoting health, prolonging our life with quality, but also preventing diseases. Okay? So non-communicable diseases are becoming very important, very prevalent. We use the term prevalent, becoming predominant, not only in developed countries where, where it became first a huge public health problem, but it's becoming also, actually it is already a big problem also in low middle income countries, or particularly in sub-Saharan Africa, okay? And now, for example, in sub-Saharan Africa, we have the burden of infectious disease, which did not disappear because of many factors, sanitary, environment, etc. We still have predominant infectious diseases as a burden for our countries, but now non-communicable diseases are also becoming burden because we are aging, we are growing, we are also changing our lifestyle, we are becoming more sedentary, we are changing our eating style, and all these factors impact on, have impact on development of non-communicable disease. So that's why it's becoming global health problem, a global threat for not only for the global population, but also quality of life, because it affects greatly the quality of life we have, okay? So as we mentioned in the first slide, within the terminology of chronic disease, non-communicable diseases, or even we sometimes call it chronic diseases, we have many. We have cardiovascular diseases, where perhaps the most common are myocardial infarction or heart attack. We usually know this terminology, and I think everyone has heard this terminology, heart attack, and stroke, which is becoming a problematic also in Africa, sub-Saharan Africa, okay? We have diabetes, we have other heart conditions, we have cancers growing as well, becoming very important, and we have a condition, is more a condition than a disease, which is high blood pressure. It happens because of changes, and we'll talk about that, changes in our cardiovascular system, okay? So let's start with diabetes. Everyone heard this terminology, certainly, because it's particularly in this since yesterday, because we have been listening to the music, very interesting music, very powerful messages there. If you pay attention to the words, actually the wording in the music is on prevention. Okay, so Diabetes is considered as a metabolic disease. There are many that result from changes within our organism, within our body, okay? So, and it is characterized by elevation of blood glucose, which leads to serious damage. And usually it leads to serious damage to heart, to kidney, to eyes, to nerves. Because the terminal organs, you know, the distal organs, why eye? Because it's a terminal organ. Kidney is a terminal organ. You know, like foot, you have heard diabetic foot, it's a terminal organ. So, because of alterations that it produces, it starts affecting the function and the blood supply in these parts. Then, you know, all the complications come. We'll talk about the complications in brief terms. Please, if I complicate things, my background is medical, and sometimes I forget that, and I'm trying to simplify and use lay language. But if I use any terminology that is not clear, call my attention. Okay? So, what are the symptoms and signs? You know, these are called like cardinal, like the ones that signal us there is probably diabetes, which is, if you pay attention with these P's, in medical terms, it's 3 P's, you know. Polydipsia is excessive thirst, okay? Excessive appetite, polyphagia, and excessive urination, polyuria. So very cardinal signs, you know. If suddenly, you know, we have, everything is okay with us, but suddenly we have been going a lot to the loo, or we are feeling very thirsty all the time, instead of drinking, we keep thirsty, etc. And particularly if we have other risk factors, we need to think about it, okay? Think about diabetes and test it. Only way to diagnose is when we test, okay? Because this only with science we cannot diagnose. Diabetes also leads to weight loss, fatigue as well. Fatigue, you know, people feeling tired all the time, loss of energy, you know, and some changes in our vision, okay? These are cardinal signs, okay? So these are here very well showed in this picture, you know, excessive thirst, constant hunger, you know, polyphagia means all the time I feel hungry, I eat, but I feel hungry all the time, okay? Fatigue, excessive tiredness, and what is the excessive, you know, these are the main 3 P's, but of the disease, we start having other symptoms, you know, blurred vision, tingling of feet and hands, because of nerves that, you know, the human body is made, it's a very complex, has a very complex infrastructure. Have, you know, muscles, bones, everything, but has vessels, veins and arteries, but also have nerves that allows us to feel, you know, so nerves, that's why we feel like this. We feel very tired as well, okay? To simplify things, we are using these classifications, okay? Which is diabetes type 1, type 2, and pregnancy-related diabetes, okay? The most common diabetes is type 2, which is the diabetes related to the lifestyle, okay? The one that we can prevent. The type 1, the onset is early, and it is related to, eventually, there are lots of discussion around that, probably related to an infection that destroys cells that produce insulin, and that's why it cannot convert sugar that we have blood to differently in type 2, here, because of our the pressure we put in our body because of our lifestyle, because of inactivity or sedentary lifestyle, because of burden of overeating, etc., we develop kind of failure or insufficiency of insulin that we produce. We still produce, different from type 1, where the infection destroys the cells that produces. In type 2, we still produce, but not in enough quantity to take away the sugar from the blood to where it is needed, okay? Or to store in other places. So the focus, particularly in media, because this is preventable, with some critical changes in our lifestyle and our habits, we can change it. So the focus is on diabetes. Is it worth mentioning this is diabetes 2, type 2? No. We can talk in general terms, diabetes, because when we go to technicalities, we get complicated. So in general terms, we always talk about diabetes, full stop. We don't need to talk about classifications, etc. Risk factors of non-communicable diseases are similar for all. They are all have common risk factors, and they are very well known. It's not that someone sat in our office and decided these are risk factors. There are strong evidence related to that. There is scientific evidence related to the link between these risk factors and the development of these diseases. So what are these? Okay, there are risk factors such as family history of diabetes. You know, because we can have genetic predisposition. So it makes us more vulnerable to develop diabetes if someone in our family had diabetes. Similarly for hypertension, but we'll talk about that later. As we grow, as we age, also the risk of developing diabetes increases. Is natural because our functions, you know, is like, I apologize if the analogy is not very good, but it's like the car when it gets old, the parts become a bit more dysfunctional. It's similar. It depends on different individuals, but of course our parts will be dysfunctional along the time, okay? So to keep it properly functional, we need to behave. So age will another risk factor. Some ethnic groups are more vulnerable than others. There's also some, but you can also mention, it can be also related to, you know, you cannot separate family history with ethnicity. They are linked. Physical inactivity, we spoke about that, you know. We consume lots of energy in form of sugar, but we don't use it, we don't spend it, it accumulates, and it provokes, it produces burden for our organ that produces insulin to convert, so it becomes also problematic. Overweight, obese, you know, insulin that we produce also become, because of obesity, because of overweight, we become insulin resistant to, so our insulin doesn't do the work that it's supposed to do. Then, you know, another risk factor of diabetes is also high blood pressure. They sometimes exist simultaneously. High blood pressure is more a condition than a disease. Another condition is also high cholesterol and smoking, okay? These are risk factors which can worsen the diabetes. Complications. We have many complications, and you can see it's a terminal organs. It's like the end organs, brain, okay? Eye, and of course you might have known people who became, who had a good vision, but because of diabetes lost their vision. Yeah. You know, heart disease, heart attack, etc., because the vessels become thickening, sexual dysfunction, amputations, you know, because of complications developed, particularly in the foot, It's very commonly called diabetic foot because of the complications developed because of diabetes in the foot, etc. And also kidney failure. It's becoming a huge problem, you know, and the quality of life also diminishes. So prevention, what we can do. Of course, one of the main preventive approaches for diabetes is nutrition. You know, we need to choose or we need to adopt appropriate diet. You know, diet, mistakenly, sometimes when we talk about diet, we think about eating less. Diet is actually the terminology that is used, you know, because we have different types of diet, Mediterranean diet, etc. It not necessarily means that you have to eat less, but it's the composition that you have to choose. So it's a choice composition of foods that you take. Okay, so there are foods that you are encouraged to take often, which are very good also for different functioning of the body, which are these ones represented here. You know, oil-based salad and then some, this you can take often, like avocado, olive seeds, etc., peanut. This group of food you have to take sometimes, not exaggerate, okay? And these ones you have to limit, like the ones that are rich in fat and others. So prevention, still, you know, try to have a healthy body weight. Try to be physically more active, healthy diet, and avoid alcohol in moderation, because it also impacts in habits. Okay, so another disease is not disease, a condition that we need to talk about today. It's hypertension. It's also you don't have symptoms or signs that makes you suspect that you have hypertension to go and seek help. Usually it's silent when many times, particularly in clinical setting, many people, the first presentation of these conditions is like a stroke or myocardial infarction. The first time they become aware that they have high blood pressure when the family takes them to the hospital because they had stroke, or the family takes them because they had a heart attack. It's not good. It's failure of screening. So if people are aware before, they keep checking. Let me check. And particularly as we age, we need to do checkups, like the way we do for, other things. So hypertension is diagnosed if the blood pressure in different days, when measured, is above 140 millimeters of mercurium and 90 diastolic. This is systolic on both days. Means, simplifying, when the blood, we have different classifications of high blood pressure. Okay, we have borderline, we have high blood pressure, we have very high blood pressure. Okay, different classification. This is simplified. Okay, but what we need to retain is that if the health professional tells us after measuring your blood pressure is high, we can ask how high is it? Is it moderate? Is it very high? Okay, and to diagnose hypertension, we need to have at least two measurements in different days. Because, you know, blood pressure, for example, if you are someone very anxious or stressful, you go to a clinic, your blood pressure, only by thinking of going, your blood pressure starts raising. It's like when you go to exam or something like that. you know. And you see a doctor, you are very anxious trying to see what you have, what the doctor is going to say. Your blood pressure naturally can increase. It doesn't mean you have high blood pressure, okay? That's why the measurement needs to be at least twice, just to exclude any occasional situation. Is that good, okay? Of course, high blood pressure will lead to different cardiovascular diseases, and this includes particularly stroke, which is very common here in sub-Saharan Africa. You know, even among young people, people below 40 years of age, it's very problematic. So here, for diabetes, we can also do the same thing. We classify here risk factors in those that we can modify and those that we cannot modify. Let's start here. Of course, we cannot modify our family history. We cannot modify our ethnicity, okay? And our age, we will be growing, so we cannot modify. Perhaps we can also have other coexisting factors that perhaps we cannot. It depends on what comorbidities we have. Some of them we can, some we cannot. But the things we can modify is we can choose our diet, what we eat, what we don't eat. Like, for example, we can choose not to eat sugar, for example, not to have sugar in our meals, or have limited amount of alcohol, for example, okay, here, and not to smoke, for example, to have more physical activity and try to do something about our weight. So these are the things we can work on it and we can modify, okay? Once again, it's a silent disease. It's asymptomatic because we don't have symptoms of it, okay? And the only way we can know we have diabetes is if we measure and the measurement shows that it's high. It's same with diabetes, okay? So some of the symptoms when blood pressure gets to a certain level includes, you know, like headaches, nosebleeds. I mean, if you have this kind of symptoms, vision change or buzzing in ears, you can suspect and check if your blood pressure is raised. There are other causes of these things, okay? In severe hypertension, you know, you can vomit, you have nausea, you can get confused, okay? But again, this also can happen with other things. For example, if a person is starving, can have some of these things. Nausea. Anyone have spent more than 12 hours without eating or having a drink? It can have these things, you know. If you are dehydrated, if you don't have enough liquids, you can have also. So the message here is that, okay, you go to the health professional, to the clinic, to the hospital, health facility, you check for other causes, but measure or ask for measurement. You know why we are stressing this thing? Because often you go to health facilities, particularly in our setting in Africa. You go to a health facility where they have burden of patients. They have too many patients to see in short time. So they will ask, what's your problem? What brings you here? Do a quick interview, you know, what we call anamnesis, and then examine you quickly. And often, and you perhaps have witnessed this, often they miss the opportunity to measure your blood pressure. Is that true? Anyone went to the clinic and went out of the clinic without the blood pressure being measured? Is that true or not? Yeah. So it's a opportunity lost. You are in the clinic, doesn't take much time, is a great opportunity to check. Because it can be the first opportunity to check beforehand, before it gets complicated. Okay? So the complications here, you know, again, the terminal organs, because the damage will be, the pressure will be in the terminal organs. The high blood pressure is like a pump. You know, if you have a water circuit and you have lots of pressure in one of the parts, what will happen? It will burst, you know? And, you know, vascular events, particularly hemorrhagic, is due to high blood pressure. You can have a stroke here, hemorrhagic stroke. You know, you can have myocardial infarction. You can have kidney failure. Because of the pressure, you damage your kidney. Okay? I'm okay with the time, or yes? Yes, yes, please. Okay. Prevention. So we need to prevent. How? Okay? There is strong evidence that salt contributes, consumption of salt contributes for raising blood pressure. Okay? For different, particularly in African contexts, for some reason, and you will find lots of literature about it, this African population are very sensitive to salt. And it's a main problem main risk factor for high blood pressure in Africa. Then you can prevent, so to prevent, you have to reduce the consumption of salt to less than 5 grams a day. You know, salt is hidden in many things. You know, particularly ready-made food. You know, like lots of ready-made food, lots of salt. You don't have to add salt, you know. It's very dangerous. So, sorry. So to prevent, you have to eat fruits, vegetables regularly, particularly banana. You know, banana is very good for cardiovascular system. It's very rich in potassium. It's very rich in water. Okay? Potassium is very good for vessels, particularly arteries. But all other fruits are important, okay? Have seasonal fruits when the season is there. It's very important. You need to avoid saturated fats. Fats will thicken the vessels, particularly arteries, and the arteries will lose their function, their elasticity, and the blood will raise. So you have to avoid tobacco, which also damages blood vessels. You have to reduce alcohol consumption and be more active physically. Okay? You can control your blood pressure, you know, once diagnosed. Once the doctor says your blood pressure is high, you need to keep track. You need to keep taking medications. Only medications is not enough. You need to take medication, but you also need to follow other guidance from the doctors, like adopt healthy lifestyle, be more active physically, try to be less stressful. You know, we can arrange ways to be, you know, distract ourselves, relieve our stress, etc. It's not easy. You know, the risk factors to change is not easy, but it's not impossible. There are people with life changes have managed to control diabetes as well as high blood pressure without taking medication, which is shown in scientific evidence. So it is possible. It's not impossible. Okay? Take medication as prescribed on time. Do regular checkups. See how your blood pressure is managed, and again, reduce and manage stress. Let me say one more thing about you know, changing lifestyles. Behavior. And perhaps you have known or you heard about anyone who wants to stop smoking, stops, you know, is convinced tobacco is bad, I need to stop, stops. But for some reason, peer pressure or social interaction, etc., person goes back, you know, and sometimes gets worse. I mean, takes more cigarettes than used to do before. Same thing with diet. Same thing with our routine. Many routine things that we do that are harmful for they are very difficult to change. Right or not? Yes? But we need to keep insisting, persisting, you know. Small changes, keep encouraging people, keep up, you are doing well, you know. There's no quick wins, not quick gains. We need to go, so we need to raise awareness for people. These are hard things, but we need to keep trying, doing, supporting each other to change. And there are also environmental things. Like media, you can also advocate. For example, in some urban areas, urbanizations, I don't know about your cities, you know, but like in Luanda, for example, my colleague there, or in Mozambique, and like in Cape Verde, I don't know if someone from Cape Verde, but also in other countries that I visited, you have parks where they have machines for exercise in open air. You have gardens that encourage people to go out and walk. You have, along the streets, you have footpaths that are very attractive for people to, end of the day, walk. Is that true or not? Sometimes some politicians, some governments do these things to improve the quality of life of people there, but some don't. So media has a role to play, to advocate, advocate for green spaces, advocate for spaces where people can go themselves, take their kids, etc., relax, walk, do some quality family time, as well as quality to improve their quality of life by walking, etc. Okay? So we came to the role of mass media. So there is important link between media provides an important link between the rural residents and the vital health information. Not only rural, okay, in urban areas as well. In rural areas, you also have problems of diabetes and high blood pressure. But perhaps in urban areas, the problem is worse, okay? Because people are more sedentary and the diets are more harmful, like we tend to, in urban areas, tend to have more processed foods that are ready made. In rural areas, you often have opportunity to have homegrown, locally grown food, And in African context, when I go, I do lots of district work, field work in districts. And you know what they serve in breakfast? Natural things, like sweet potato or cassava or natural things that are produced locally. See, even in, it's not big hotels like this one, but these are simple residential, if you have been in districts, simple, they serve in hotels natural local things as well. But it takes time to change. Let me say that advocacy, the pressure of the civil society, particularly people only can pressure if they know, if they are aware of these things. And here social media is very, very important. But in developed countries, people are much more aware of these things now. And there is lots of pressure to government, like to reduce pollution, to open space, to keep green parts of the urban areas, etc. There's lots of pressure of the society for the government to do that. That's why the governments in these countries, they do that. So we also need to do same thing here. Okay? Health helps workers expand their audience reach. You can, through media, you can reach much more people. So you can educate literacy. People can, because these are abstract concepts. You talk to someone, and particularly people with low literacy, and you say you have high blood pressure or you have diabetes, then they will ask, what is this? And say, no, you have diabetes because your blood pressure, your sugar level is uncontrolled, is very high. They will still, it will be difficult for them if they have low literacy to understand. But we need to use and try. So we need to have responsibility to report accurately health and science information, try to encourage more than to scare people. Scary campaigns are good, but they are very self-limited. You have seen scary campaign, for example, in tobacco. You have tobacco where they have I don't know in your countries. A part of the message, there are some very strong photos.
Yeah, visuals.
Visuals, yeah? But like a smoker that goes and buys a packet of cigarettes, how many times he sees that but still keeps smoking? Has a limited effect. But it's good for people who never started to smoke or someone who is sensitive to this kind of things. Okay, not everyone is sensitive equally. Okay, and so to summarize, media has a great role. And you yourselves, among yourselves, need to see what's the best strategy to communicate, to raise awareness. For example, let's talk about hypertension and the need to screen. Okay? No country knows how many people live in their country with high blood pressure. No one knows. But WHO, World Health Organization, is encouraging people to check their blood pressure, check their sugar levels, okay? Why? Because if they don't check, it will develop, and it will develop in complications. It's too late. If they check, they can do something about it, right? If they check and they are sensitive, they will treat. You know, the proportion of people who know also and then take treatment is not also adequate in many studies, okay? There is lots of evidence. So we need to be aware. After being aware, if we have a problem, we need to do something about it and keep our blood pressure and diabetes under control. And I think that was I will skip this because I've been talking about it, and many thanks. I think thank you very much.
I know it's quite complicated to be the last speaker. I just hope I get their attention for this presentation. Well, I've started in the written press, in fact, and now I'm a multimedia journalist. I'll try to cover both sectors for you to be able to know how we can get stories, how we can in interesting stories, I mean, how to seduce our audience and how to... Well, I'll be talking about, for this presentation, with a journalistic perspective, because so many times since the beginning of this session, we have been talking about the medical aspects, but I think it's important for us, we journalists, to know really how to talk about this kind of information, how to relate information, how to give those information to our public. There are people from radio in the room. Can you just raise your hand, radio people? Multimedia, online, written press, television? Okay. Well, my presentation would be, we've been talking a lot about infertility, but I'll be more on child marriage and all other topics you see here. How to be able to grasp the attention of us and how to reach out the community. We as media people, I'll try to swap to French for my friends over there. They said that they haven't been able to understand something earlier. But if it is in English, here I'll try to talk in French also sometimes to allow them to understand what I'm saying. Nous avons un rôle très important, donc en tant que journaliste, pour atteindre la communauté, mais surtout dans la promotion et l'éducation des gens. Donc, the health education and promotion in our societies for decades, that's the media, the main role of the media in our society. The medical, we've talked a lot earlier about the preparedness and the community education. I think it's important we as media people to bear in mind this point when preparing our stories, because so many times we don't give attention to that. We just have a story, we cover the story, and we forget about the people who will be reading this story. And this importance, education, what will they do with the story afterwards? What will be giving to them after reading the story? If I would have shown you this picture 4 years back or 3 years back, it would have been complete nonsense to all of us. Yes or no? Yes. Today, when looking at this, we don't even need to talk about it. Everyone knows what happened. I think we media people, we have really understand how health information is really important for communities since the COVID-19. Exposure to media and knowledge relating to COVID-19, for example, increased over time. I'll be talking about the Mauritian perspective, the Mauritian experience. As Mihak said, I lead a team for a radio station, and I'm also a presenter for the radio station. In one briefing, a Friday evening, one colleague, she was talking about what is happening in China. This was for the very beginning, and Wuhan was not already confined, and the story was in the international media. She came in the briefing and saying, you know, I have a story about China. I was like, China? How our public will be interested with what is happening in China? And she keep on explaining, you know, this can be a very, very big issue. I have my sister working in the Emirates. She is air hostess, and they are preparing because this can reach every country. I was like, I don't think we can have this story, but okay, go ahead. And the next day, I was presenting the news, and Wuhan was confined. And I realized that this story needs to be spoken on our radio channel. And we started with this information. And I can tell you, it was a Saturday morning, the first time information was given on the radio. We were the first media in Mauritius to talk about the coronavirus. And on Monday, we canceled all the flights with China. And everything went in a very dramatical way just after this information. It's the first time Mauritian people were taking cognizance of what is happening in China, and this kind of information and this information was very, very important to our community at this very moment. In this chart, it's a survey that was published recently in Mauritius, following a survey that was published in Mauritius recently, taking into consideration the COVID-19 period. You see the radio. The radio is among the three first institution, I can say, that people that is getting the attention of people. All other things are on the decline, and the youngsters, the youth, the Gen Z, they are keeping informed à travers la radio, with the radio. I was talking about the first, how everything happened in Mauritius. Our first lockdown was in March 2020, but we were really unprepared because everyone was thinking that it's so far from us, this would not reach Mauritius. We were neglecting what was happening abroad in Europe, in Asia, but very rapidly we had so many regions in the red zone, rapidly, because the number of cases exponentially it started to gain the country. And as media, my media group from where I work, the DEFI Media Group, we have the written, we have the radio, we have a multimedia platform, the online, and we have also a daily newspaper. We have, at the very beginning, started to act quickly, act decisively, and communicate clearly, because all our platform, we've decided to, on the very first day when the authorities started talking about the lockdown, to have another briefing session with all the heads of department to really, for all the platforms to start acting quickly with the decisive information, communicate clearly of what is happening, what useful information we need to have. Maybe I can... sometimes people say that radio is maybe the easiest media to convey information, because you can be doing something and listening to the radio. The radio is free of charge in Mauritius, you don't have to pay, and it reaches millions of people also for the audience. Radio powers to educate and inform in everyday life and in emergencies, just as important today as has been. The situation in Mauritius right now, I told you earlier that the trust, the confidence of people in radio, we are gaining a new audience every month. Every survey saying that we are having new audience, new listeners. And when we put the question why, people have discovered health information. The first, when we put the question, why are you listening to us now? They're saying that you are more on health information. I think health information is very, very important, and we need to continue to educate via the radio to give health information. One of the main reasons also, radios goes where newer technologies can't because of electricity problems, of connectivity problems. This guy is a doctor, Dr. Sunil Ganesh. He's a cardiologist. This interview on television from my channel has a very, very important and significant interview for the Mauritian community. You realize during the COVID period, we were telling people you need to wash your hands 5 times daily, 10 times daily. But did you realize that people didn't know how to wash their hands? This the Dr. Sunil gave an interview explaining how to wash their hands and how to clean your mobile phone. It was very important because the virus was stuck in your mobile phone, and it was a very interactive session with him. You will see his explanation. You have a voice? It is in.
L'eau potable est facile, nous passons là bien méticuleusement, dans tout ce coin partout, parce que le virus, vous prenez un grain de sable. Un grain de sable beaucoup plus 10 000 fois qu'un virus. Alors imaginez-nous, les cas vraiment partout, les cassettes là, et à moins d'occasion.
Well, he's explaining that the virus is very tiny.
Mais on prend l'alcool là, ou avec un coton, ou nettoyer bien, prendre le temps.
Look at this figure. In 1 hour, this video goes viral on our website. And for Mauritius, 116,000 views is quite important. In 1 hour, young people, the adults, everyone shared this video, and how this can show you how influent we can be, how important this kind of explanation during epidemics we can have to help the community. During we had a second lockdown afterwards, even if the prevention were given. We had a second lockdown, and during this second lockdown, we changed the strategy. We changed the strategy because we realized that the main communication, it was from the authorities, and we had to broadcast a press briefing which was live on radio. And this also was followed by 100,000 people daily when it was broadcast at 3 p.m. every day. They were announcing where will be the red zone, because when it is the red zone, you can't move from the zone. And this was a great inconvenience for Mauritian people, because you don't work, you don't go outside, shops are closed, supermarkets are closed, and so on. And those information were related on all the platforms, and the media people plays the game. Ils ont joué le jeu. They broadcasted it on written press, they broadcasted it on television, on the radio also. This is from our newspaper. This situation, this young lady, Noor Jahan, she was among the first people to tell to the Mauritian people, I was COVID positive. When COVID-19 reaches Mauritius, it was really a taboo. People didn't want to be in close contact with your family, even if other people were not COVID positive. And she, on our radio channel, she phoned the channel to say, I had a prayer at my place, and there were 250 persons coming to the prayer, and maybe if you were in this prayer, maybe you are COVID positive. And she gave this testimonial on the radio, and believe me, over 100% in the prayer was positive. We have been, through her testimonial, we have been able to help the authorities with the contact tracing. All those who were in the prayer at her place, they went to the hospital to have their test done. And over 100% were tested positive. When we did a live Facebook with her, see the picture, the figures, 49,000. Yeah. She was very powerful because she helps us a lot in breaking the stigma, I can say, about COVID-19. People from Mauritius could through her put a figure on COVID-19, and she was regularly intervening to say, I'm going well now, my family, because in her family almost 20% were COVID positive, and she was regularly giving testimonial about how things are going for them. We have been able to build a network, the COVID-19 patient, through television, through the written press, and with a WhatsApp group, people were keeping asking for information. We had the WhatsApp group also to communicate more regularly with our listeners and with our audience. Crisis information, you know how it works. The authorities in my country particularly, during the COVID-19 period, they refused to give information every day because they think that people will say that it's because of the government. They have not been taking good decisions. That's why people are being tested positive. But the crisis information, it's the media. We have an important role in establishing this kind of communication via the community. I will now talk about we've been talking about the gender-based violence earlier. It's another Mauritian experience. This study recently published in Mauritius, 38% disagree and 45% agree that men and women have equal rights in Mauritius. It's a big figure. It's important to take cognizance of this for what we will be talking about just after. We had testimonials from women saying that they accept the violence because they need to obey. They need to respect. That's what they talk about. And all those figures, we as media people, we should relay those kind of those kind of information in our papers and channels to make people aware of this is not we don't have to keep this state of mind, and we need to move on and change really our the gender-based violence. So how can we portray this kind of GBV? How to portray it in our papers? How to relate stories? We recently have a survivor giving a testimonial about how she has been able to. Earlier we were talking about to be economically independent. She explained she was being beaten by her husband, and one day she decided to break the chain and to go back to her family house. And it's quite difficult for a woman who has not the independence, financial independence. And she was explaining how she started to look for help via NGOs and the media. Her story was published on a paper, and through this story, she has been able to have a lot of help, a lot of information, which help her in having a house, having a work, and to have food for her children also. I think we need to portray those kind of information, having survivors' point of view, and draw attention towards positive stories of resilience. At 13, the place to be for a girl is at school. It's nothing new for you. It's not the situation in so many African countries right now. Gender equality in education benefits every child. We come across all kind of stories on the web about the child, because you're a girl, you will get married, you don't need to go to school, you don't need to learn, you don't need to have education because you'll get married, and your husband will pay everything for you. But today's, we as media, we should report on those kind of misconceived information and saying people that it's not the case. Child marriage, girls, not brides. This campaign started in Mauritius recently, and it was like, what are you media talking about? It's very important to talk about this issue, because more and more parents, families believe that at the age of 15, 14, they can get their daughter to be married. We had a story, a very. I'll let you watch this video, and afterwards we'll continue. There's a sound, I think. Well, it's in French and in Creole, the native language in Mauritius. Yeah. Well, this is the story of Ruwaida. She is 13. You will see her picture. She is 13. She gets married to a young boy of 17, and she was pregnant, and she died. She wrote a letter that you see, the letter, the manuscript of the letter, and the family of the guy said that she didn't know how to cook food, to clean the house. She was beaten by the husband because her husband's mother was saying, your wife doesn't know how to cook food, to clean the house. She was only 13. How can we accept that a little girl of 13 years of age being a woman in a house. At 13, the place of a girl is at school. It's not handing a house. And this story was widely spread in Mauritius. And through the media advocacy and through the media pressure, we've been able to help to change the law in Mauritius. Now, the official age of marriage is 18. Formerly it was 16, but now it's 18. No marriage is celebrated under 18. Since March this year, the law has changed. Some cultures in Mauritius, they were trying to celebrate those marriage undercover, but now the police is sensitized, and we have not got a marriage under 18. But the situation is that this case of Ruwaida helps us, the media. Earlier I was saying how to get good stories, how to be able to have those stories and to publish them. After the decease of Ruwaida, we are asking the authorities, can we have figures of marriage celebrated for young people 13 to 15 years of age? It said there's no official figures. It was impossible for us to have the official figures. And how we media people, when talking about those kind of issues, have those official figures? We have gone through I think the slide is. We have a minister of gender issue. She intervened at the UN. The figures that they didn't want to give to the media, she gave it to the UN. And we've been able to, via the internet, having all those figures on the net, and it was the official figures of Mauritius, which will be the connection, keep on disseminating information, and looking for good stories, stories that touch people, stories that put a smile maybe, or if it is something difficult, but you know how independently and responsibly don't give those stories to our audience. Thank you.
Good afternoon, everyone.
Eu agradeço a Merck Foundation por nos ter convidado.
I thank Merck Foundation for the invitation.
Eu acredito que é a primeira vez que provavelmente tenham participado médicos, mas desta vez também veio os jornalistas e acabamos por vir sozinhos também. Os médicos ficaram, né?
So I believe maybe it's the first time that the doctors were able to be here together with the journalists.
Sim, e acredito que de hoje em diante o Sindicato de Jornalistas Angolanos poderá cooperar com a Merck Foundation.
And I believe that from now on, the syndicate of journalists in Angola will be able to cooperate with Merck Foundation.
Bom, depois destas considerações iniciais, eu vou apresentar o tema cujo título é Como a mídia pode quebrar o silêncio e ser uma voz forte para os sem voz, através do seu trabalho relacionado a questões sociais e de saúde sensíveis em África.
So after these initial considerations, I would like to present what I'll be talking about with the theme that how the media can break the silence and be a strong voice for those who don't have a voice through their work, relating to questions in socially, in health, and sensitive topics in Africa.
Bom, embora sendo a África tema geral, mas eu vou partir de uma experiência angolana.
Although we're talking Africa in general, but I will talk to you about the Angola experience.
A temática referente à mídia enquanto instrumento de educação para a emancipação, para a cidadania, tem suscitado várias abordagens e questionamentos sobre a sua real função ao longo da história do homem e da humanidade, no sentido de influenciar o indivíduo na mudança de comportamento.
So the theme that referred to the media as an instrument of education and emancipation of citizenship has been had many approaches in these questionings about its real function throughout the man's history and humankind, or in the meaning of influencing the individual in the change of its behavior.
Pois é, a nossa comunicação tem 3 objetivos. O primeiro objetivo é procurar conceitualizar os mídias, trazer à luz, ainda que breve, o seu objeto social ao longo da história da humanidade.
So our communication has 3 main objectives. The first is to give a concept and bring to light, even if it's a brief, what is the social objective throughout the history of humankind.
Pois é, o segundo objetivo é demonstrar o impacto dos mídias na sociedade, não é? Na sociedade, na educação para a saúde em Angola.
And also to demonstrate the impact of media in the society, of education and for the health in Angola.
E por último objetivo, temos manifestar a importância das rádios comunitários como novo tantã para a emancipação cívica das comunidades nos processos de desenvolvimento social e econômico.
And also, lastly, is to manifest the importance of the radio communities as a new tantan to create the civical emancipation of the communities in the procedures of the development of the social and economical development of these societies.
Aqui eu falava em tantã. Tantã é um instrumento bastante conhecido na zona da África Central. Talvez aqui o meu colega do Congo Democrático poderá ajudar. É um instrumento musical que serve para convocar, para chamar pessoas a participarem em assembleia para a resolução de algum problema.
So I don't know if you are aware, but tantan is a musical instrument that is very popular in Central Africa. Maybe my colleague here from Central Africa will be able to relate to this. It was an instrument used in the communities to call out the people to gather to have a forum to discuss something important for the community.
Pois é, então podemos ir para o primeiro objetivo, que é a conceitualização dos mídias e o seu objeto social ao longo da história da humanidade.
So for the first is to bring the concept of the media and its objective to the history of humankind.
Pois é, então ao longo da história da humanidade, sobretudo no último quarto do século XIX, a mídia foi considerada um meio importante para a aquisição de conhecimento de assuntos ligados à condição humana sobre fenômenos sociais de interesse público.
So throughout the history of the humankind, especially in the 4th part of the 19th century, the media was considered as a very important way of acquisition of knowledge and matters related to the condition of humans being a phenomenon, social phenomenon in political interest.
Também foi útil e continua a ser importante meio para a disseminação da cultura e da educação humanística, embora no século em referência tenha privilegiado a nobreza e a burguesia que estava no poder.
Also, it was useful to continue to be used as an important way to disseminate culture and education, even though it was being used and referred and it was privileged by those in power, the noble people.
A expansão da mídia e a sua utilização nos séculos 20 e 21 alavancou toda a estrutura social, política e econômica, tanto nas sociedades mais desenvolvidas como nas sociedades menos desenvolvidas, no caso dos países africanos, atingindo as esferas sociais bastante sensíveis como a cultura, a educação e a saúde.
So the media expansion and it's during the 20th century and the 21st century was pushed all the social structure, political and economical, in all the societies, the more developed societies, and as well as the less developed societies. In cases of the African countries, it reached the social spheres, also very sensitive related with the culture, education, and health.
Pois é, aqui neste contexto, ela deixou de servir somente os interesses da nobreza e da burguesia, graças à massificação e à industrialização tecnológica.
So the media now was no longer used only for the noble people, thanks to the massification of the media. Now, thanks for the industrialization, the technological industrialization.
Hoje, qualquer cidadão tem a possibilidade de ser sujeito e objeto da ação dos mídias, que no instante pode ter acesso à informação ou conhecimento da realidade social, política e econômica do seu país, em particular, e do continente em geral. Em suma, o cidadão é parte substancial da sociedade da informação nos tempos modernos e ainda não é, e deve-se, se ainda não é, deve-se tudo fazer para que assim seja.
So nowadays, any citizen has the possibility of being the object of the action of media, and in an instant, he can have access to information, knowledge of the social reality, political and economical of its country, especially in the continent in general. In summarizing, the citizen now, it's a substantial part of the society of information in the modern times, and if he's not a part, that we must do everything so that it can happen, so that this can happen.
Então, com o desenvolvimento da indústria das telecomunicações, previa-se que os mídias facilitassem a participação do cidadão na vida pública, na democratização da sociedade e na veiculação de uma educação voltada para os valores humanitários ou humanísticos, com a disseminação da cultura na sua pluridimensionalidade.
So with the development of it was expected that the media would facilitate the participation of the citizen in the public life, as in also in the democratization of the society, and as being a channel turned to education for the human values, as with also with the dissemination of culture in its multiple ways.
Porém, não foi este o entendimento de alguns filósofos como Teodoro Adorno e Max Horkheimer, ambos da Escola de Frankfurt.
So, but it wasn't the same understanding for some philosophers like Theodor Adorno and Max Horkheimer. They're both from the School of Frankfurt.
Para estes filósofos, a industrialização e o desenvolvimento tecnológico que se registrou nas telecomunicações potencializaram os mídias a tornarem-se meios de alienação, ao ponto de inibir as liberdades individuais.
So for these philosophers, the industrialization and the technological development was a way of the telecommunications to give the media the power where they would be able to alienate people to the point of taking their individual freedom.
Yeah. Gilles Lipovetsky, filósofo francês, nas suas apologias sobre as sociedades pós-modernas ou hipermodernas, descreve a sociedade industrializada como aquela denominada pela inovação tecnológica e pela imaginação dos mídias. Aqui, quando se fala da imaginação dos mídias, estamos a falar da publicidade, não é? A colonização do seu universo pelos mercados, a economia, política, cultura, a sociedade, não é? Aqui celebra-se o consumo como a expressão pessoal, pluralidade cultural, bipolarização social, que entre os ricos e os pobres, e falência das metanarrativas emancipadoras propostas pela Revolução Francesa, que é liberdade, igualdade e fraternidade.
So a French philosopher, in his apologies for postmodern or hypermodern societies, describes an industrialized society dominated by technological innovation and the imagination of the media, advertising, the colonization of its universe by markets, being economical, political, cultural, and social. It celebrates the consumption as a personal expression, cultural plurality, social bipolarization, poor and rich, failure of the emancipatory narratives proposed by the French Revolution, which consists of freedom, equality, and fraternity.
A forma como Lipovetsky apresenta o comportamento dos mídias não está distante da perspectiva teórica de Adorno e Horkheimer, que fornece o suporte sociológico da concepção dos efeitos dos mídias numa sociedade resultante da progressiva industrialização e o desenvolvimento das telecomunicações.
So the way the French philosopher presents the behavior of the media is not far from the theoretical perspective of Adorno and Horkheimer, which provides the sociological support for the conception of the effects of the media in a society resulting from progressive industrialization and the development of telecommunications.
Não obstante da metamorfose dos mídias ao longo da história, e a visão negativista dos mass media, como podemos observar em Adorno, Horkheimer e Lipovetsky, traz-nos reconhecer que os meios de comunicação social contribuem na aprendizagem de valores, na mudança de comportamento, relativamente estáveis influencia na alteração dos processos de desenvolvimento da humanidade ou do ser humano.
So despite the metamorphosis of the media throughout history and the negative view of the mass media, as we can see in Adorno, Horkheimer, and the French philosopher, we are pleased to recognize that the means of social communication contribute to learning values, to changing behavior, relatively stable, influences the alteration of human development processes.
Eu agradeço a disponibilidade
I thank you for the availability.
e nós estaremos, com certeza absoluta, como a nossa primeira-dama é uma das embaixadoras também, acredito que tanto o sindicato como o gabinete da primeira-dama talvez possam consertar alguma coisa sobre isso.
Yes, so along now, because our First Lady is one of the ambassadors, along with her office and our councils, we'll be able to come together and fix the problems that are existing.
Sim, mas eu procurei para percebermos aquilo que depois que acontece, a informação, então trouxe o enredo aqui como introdução para demonstrar aquilo que o mídia é e o que foi ao longo da história e onde estamos até hoje.
So I just I brought this narrative here to be able to share with you where the media is in history and where the media is nowadays.
C'est un honneur et une responsabilité pour nous de prendre la parole en ce moment afin de réfléchir sur ce thème.
It's an honor and a responsibility for us to take this moment to think about this problem.
Comment les médias peuvent-ils briser le silence et être une voix forte pour les sans-voix grâce à leur travail sur les problèmes sociaux et sanitaires sensibles en Afrique?
Our media can break their silence and be the voice for the voiceless, and they work for the social problems and the sensible health problem in Africa.
Alors pour une bonne méthodologie dans une approche triptyque, nous allons dans notre communication aborder dans un premier temps quelques considérations générales axées sur les médias.
We're gonna discuss some general consideration in the media.
Ensuite, il sera question d'épingler quelques problèmes sociaux et sanitaires fondamentaux en Afrique.
And we are going to talk about some social problem and health problem in Africa.
Enfin, à la lumière de tout ce qui sera développé dans les prémices de notre démarche épistémologique, nous tenterons d'aborder dans la mesure du possible la problématique de comment les médias seront-ils capables de sortir de leur silence pour parler utilement de problèmes sociaux et sanitaires qui rongent l'Afrique.
And then after talking about all those issues, we're going to see how we can solve those problems in media, by media in Africa.
S'agissant du premier point, il s'agit de rappeler en règle générale que les médias sont des supports qui permettent de véhiculer le message et non sans favoriser la connexion et l'interconnexion des collectivités ainsi que l'intégration sous-régionale, régionale de communautés et des États qui débouchent sur les désenclavements et le développement des sociétés.
Media are instruments that allows to give informations about problems that a society have and how we can solve those problems by treating informations, collecting and treating good informations in the society.
Dans cette optique, les médias jouent un rôle dans la sensibilisation des communautés aux problèmes sociaux et sanitaires pour des solutions efficaces et efficientes.
That's why media play an important role by treating informations and targeting some point that can allow a society to be aware of a subject and then create a good situation in the society.
Fort malheureusement, sans tomber dans une forme d'extrémisme, les médias africains sont confrontés à deux problèmes majeurs.
African media have two major problems.
Il s'agit d'une part du problème de manque de professionnalisme dans le chef des animateurs de ce support médiatique et de l'autre côté de celui de l'insuffisance de moyens conséquents.
The first problem is the lack of experience and capacity, and the second is the lack of equipment.
Alors que les médias africains eux-mêmes, en tant que vecteurs de l'information, ne sont pas pour la plupart équipés ni adaptés aux technologies de l'information et de la communication.
Many African media don't have a capacity and materials to do the work as it is required.
Et souffrent d'un déficit criant sur le plan logistique et financier. Les professionnels de médias, dans bien de cas, ne sont pas suffisamment formés et outillés comme spécialistes et experts en communication dans le domaine socio et sanitaire.
There is a lack of material equipment and financial means to do the work as it is recommended.
Deux questions se posent.
Some questions are asked.
Comment voulons-nous, dans un tel contexte de précarité et de non-viabilité médiatique, que nous puissions avoir de médias qui sont en mesure de briser le silence pour parler comme il se doit de problèmes sociaux et sanitaires sensibles qui minent l'Afrique?
How, in this context, media can be able to do the work in a very good way without all those means that required, such as financial means and logistical means.
Et à la limite, pousser les décideurs à concevoir des politiques publiques locales, nationales, sous-régionales, régionales et continentales idoines.
And also push policymakers to make good decisions so that they can improve the way the media works.
Un tel contexte ne peut que conduire inévitablement à un déficit communicationnel qui traduit le mimétisme médiatique constaté à ce jour face aux problèmes sociaux et sanitaires.
So this problem can lead to a lack of communication between media and public, and then can create an obstacle for the good communication between those two parts.
Dans le deuxième point relatif aux problèmes sociaux et sanitaires sensibles d'entrée de jeu, il nous sera difficile de les énumérer de façon exhaustive.
It's going to be difficult to list all those problems.
Toutefois, dans cette monographie, nous nous permettrons de citer les quelques problèmes suivants.
But we can talk about some subjects.
Manque de personnel soignant, sous-équipement des structures médicales, insuffisance des infrastructures sanitaires de base, environnement malsain qui favorise... Ok, manque de personnel soignant.
Lack of healthcare professional.
Sous-équipement des structures médicales.
Lack of medical equipment.
Insuffisance des infrastructures sanitaires de base.
Lack of healthcare infrastructures.
Environnement malsain qui favorise l'évolution de certaines maladies virales et bactériennes.
Bad environment that creates some disease and bacteria.
Non-accès aux soins de santé primaires, à l'eau potable, à l'électricité, à l'éducation et à l'information.
Non-access to the clean water.
Oui, électricité, éducation et à l'information. L'éducation sexuelle considérée comme tabou en Afrique à cause notamment des considérations culturelles et religieuses.
Sexual education that is not discussed because of religious consideration and cultural consideration.
Ainsi que la problématique de la prise en charge des couples infertiles.
And also the problem of taking charge of infertile couple.
Un problème sérieux pour le gouvernement africain.
A serious problem for the African government.
Sur ce problème précis,
for this problem,
nous devons de vous informer que notre organisation AAC est déjà à pied d'œuvre pour proposer aux décideurs politiques de notre pays de pistes de solutions appropriées.
We must inform you that our organization AAC is already working hard to address this problem in our country.
Voilà en substance les quelques problèmes sociaux et sanitaires sensibles en Afrique.
Here is some social and health problem in Africa.
Au regard de tout ce qui vient d'être développé haut,
after all those I've cited before.
Nous voulons à présent aborder le troisième point de notre communication, en réalité la réponse à la problématique sur comment les médias peuvent-ils briser le silence et être une voix des sans-voix grâce à leur travail sur le problème socio et sanitaire sensible en Afrique.
Now we will talk about how media can break the silence and be the voice of the voiceless in Africa.
Ainsi, deux préalables majeurs sont à considérer avant que le média ne soit une voix forte de sans-voix.
Two main aspects can be considered so that the media can be the voice of the voiceless in Africa.
Primo,
First,
résoudre la problématique de la formation de professionnels de médias.
solve the problem of training of media professionals in Africa.
Ici,
Here,
nous privilégions la formation spécialisée de journalistes et communicateurs dans le domaine socio et sanitaire pour leur permettre d'être suffisamment outillés.
we give privilege to the training of specialists in a different field in health in Africa for journalists in Africa.
Car il est difficile, pour ne pas dire impossible, à un professionnel de médias non formé comme expert ou spécialiste dans le domaine socio et sanitaire de parler aisément des problèmes irrelatifs.
Because it is difficult for a journalist who doesn't know the specialty to be able to talk about or to treat information based on subject that he doesn't understand well.
D'ailleurs, nous profitons de cette opportunité pour vous annoncer que notre organisation AAC fait du professionnalisme de journalistes et communicateurs son cheval de bataille en mettant l'accent sur la formation en vue du renforcement des capacités.
We take this opportunity to inform you that our organization, AAC, has as main goal to train journalists to be able to treat information related to healthcare in their communities.
C'est ainsi que dans notre agenda, il est prévu dès le premier trimestre de l'année prochaine une formation de professionnels de médias sur le renforcement des capacités des chroniqueurs des santé.
That's why next year, in the three first months of the year, we're going to have a training session for journalists about the capacity building of journalists in healthcare.
L'exécution de ce projet nécessite l'accompagnement de partenaires qui partagent la même vision que nous, à l'instar de la fondation Merck, la fondation Denise Nyakero Tshisekedi et bien d'autres.
The implementation of this project requires the participation of organizations such as Merck Foundation and the Foundation of the First Lady, Denise Nyakero Tshisekedi of DRC.
Segundo,
Second,
le pouvoir public africain sont invités à doter les médias de moyens suffisants pour leur permettre de travailler dans des conditions optimales.
African states should allow media to be able to work well by giving them the means that they need to work very
Aussi,
well. Also,
les dirigeants africains doivent subventionner régulièrement les médias, tant publics que privés, pour leur bon fonctionnement.
and also African government that must give subvention to organization so that they can be able to work well in their field.
Au-delà de la formation professionnelle et spécialisée, ainsi que de la subvention de médias, il appartient aux médias eux-mêmes de concevoir de programmes et micro-programmes attrayants.
Beyond financial subvention and also equipment, media should be able to work and be aware of their role in the society by informing and educating the public.
Une fois que tous ces préalables si haut évoqués sont pris en compte par toutes les parties,
once all those first steps are fulfilled,
nous sommes convaincus que les médias seront capables de briser le silence et deviendront une voix forte de sans-voix grâce à leur travail sur les problèmes sociaux et sanitaires sensibles en Afrique.
we are convinced that media will be able to break the silence and also be the voice of the voiceless in Africa in terms of subject of healthcare, health and social problems in Africa.
Si l'Afrique, à l'instar des autres continents, aura moins de problèmes sociaux et sanitaires sensibles dans les jours à venir.
Then Africa will be free of social problems and health problems in the future.
Alors je pense qu'il est mieux que je m'arrête là parce que j'ai déjà dit
I
l'essentiel.
think I can stop here because I've said
Cela nécessite
essential.
Une formation appropriée, spécialisée de professionnels de médias.
Which require training and training in specialty for journalists in Africa in terms of social problems and healthcare.
Je voudrais paraphraser deux savants africains avant de clôturer.
I'd like to quote two important persons in Africa.
Joseph
Izerbo,
paix à son âme, il a dit ceci.
Said this.
Il faut éduquer la jeunesse ou mourir.
We must educate the youth or die.
Donc la mission
the goal
que nous avons en tant que professionnels de médias,
is a media professional.
Il nous appartient
We have to
également de former de professionnels pour informer cette catégorie de la population africaine qui se meurt
that is dying
parce que l'information ne lui parvient pas.
Because they don't have the information.
Et en deuxième lieu,
and secondly,
je voudrais dire comme on le dit tous,
I'd like to say, like we say
la langue de Molière le dit,
French,
aux âmes bien nées,
to those who are well born,
la valeur n'attend point le nombre d'années.
The value doesn't wait years.
Aussitôt informé de la situation,
When I was informed of the situation,
je pense que nos jeunes filles, les couples infertiles et toute cette catégorie de la population africaine
the young girls and all
sera
the
en mesure de se prendre en charge.
will be able to take in charge themselves.
Je parle non pas comme quelqu'un qui a entendu ces choses de loin.
I don't talk about someone who heard those things from
J'en
far.
parle parce que j'en ai vécu.
Because I faced those
Et
problems.
parce que mon frère aîné le vit également.
Because my brother is living those things.
Dans cet aspect de choses, j'ai pu faire 5 ans dans le mariage sans concevoir.
I've made 5 years in marriage without kids.
Et dans la tradition africaine, et particulièrement nous qui venons d'une famille royale,
in African tradition, particularly for us from a royal family,
il est tout à fait anormal qu'un prince, sa femme ne puisse concevoir.
it is not normal that a prince, a wife cannot have kids.
Donc cette femme a subi autant tout ce que nous pouvons dire de menaces, de discrimination pendant 5 ans. Mais la grande décision, c'était lorsque dans les familles africaines, vous êtes en dehors de la maison, vous êtes en mission. Ce sont vos tantes qui arrivent à la maison, qui prennent les bagages, les affaires de la femme et vont la sortir de la maison.
My wife faced a threat from the family because she could not give birth, because she had problem of infertility. So the family was threatening to come and get goods from our marriage.
So you have first-hand experienced the stigma and the
Donc vous avez une
discrimination that comes along with it.
De la stigmatisation qui
Tout à
vient
fait.
avec le mariage.
Tout à fait, j'en ai vécu.
Thank you so much. I would want to think that from the CEO yesterday, from the president, from the first ladies, to the medical doctors, to the professors that have spoken before us, and of course the 2 colleagues that have just spoken, enough precursor has been provided to this particular topic, and I was wanting to be very brief in talking to 2 or 3 things only. And these, I would want to begin from the fact that the only point that a journalist must begin from
in ensuring that they become a critical voice of the voiceless is understanding that they are and do not exist in a vacuum. They are part of a society and they are part of a community. And until they understand what makes their societies and makes their communities, they will not be able to communicate in languages, in contexts that will tell the stories, that will change narratives. I think that's very critical. And the second aspect to that is that issues like the ones that we're discussing here, infertility, health, and so on, require high standards in terms of the journalist's ethical behavior, ethical understanding of that which we are communicating to the masses, because we are talking to issues that are sensitive, culturally and sensitive, depending on fabrics of the communities where we're coming from. And until we get to understand that and approach these issues with all ethical understanding that we need, it will be very difficult for media to communicate in voices and contexts that are going to speak to the need state of our various audiences. But beyond that is the fact that we all have entered the journalism classrooms, and we've all, learned the 5 W's, H, and so on about journalism. But what still lacks is the fact that in most cases we would want to still believe that we are giants and therefore, masters of all trades, forgetting that in fact we are masters of none. And until, to borrow one of the professor's words yesterday, until we get educated ourselves, not education as in classrooms, but understanding the subjects, understanding our communities, we will not be able to tell the stories in such creative manner, a manner that is going to build a critical mass of knowledge for our audiences. And then, like parts of where I come from, southern part of Africa, we still have a problem of literacy and what have you. And we will only become voice of the voiceless if we are able to break the jargon into chunks that are going to be swallowed at that particular level. And then there is a very critical aspect that's with the health professionals, governments, and other stakeholders. The media require information. Minus that, the media will not be the voice of the voiceless. Thank you so much.
Ok, merci. Donc c'est Ibrahim Harouna, je suis le président de la maison de la presse du Niger. Donc je veux parler en français avec la traduction. Merci à la Fondation Merck de nous avoir invités pour partager notre expérience.
Thank you to the Merck Foundation for inviting us and to share our experience.
Je viens d'un pays, le Niger, où le taux de natalité de la population est très élevé. On parle de 7 enfants par femme.
I come from Niger, where the country has a report of birth of 7 kids by 7 enfants
par femme.
7 kids by women.
Donc vous voyez, le taux de natalité étant très élevé, la population s'est développée très vite.
The number of people is growing very fast.
Donc on est passé d'une dizaine de millions d'habitants à 21 millions d'habitants en 30 ans.
In 30 years, we went from 10 million of people to 23 million of people.
Donc vous voyez, donc les problèmes sociaux se sont développés.
So social problems have developed very fast.
Mais dans ce contexte où vous avez une population qui se développe ainsi,
and in this context where you have the population that is growing very fast,
c'est étonnant de dire encore qu'il y a un problème de natalité et d'infertilité.
It is very, very strange to talk about infertility.
Mais malgré tout, il y a des milliers de femmes nigériennes qui souffrent de ce problème-là.
But there are many women in Niger that suffer from infertility.
Et donc ces femmes qui souffrent, qui ne savent pas à quel sens se vouer,
those women who are suffering and who don't know how to get solution to their problems,
les médias ont une très grande responsabilité pour faire ressortir ce problème et aider ces milliers de femmes à trouver des solutions.
media have a very important role to play and to help those women.
C'est pourquoi l'organisation fêtière qu'est notre organisation, la Maison de la Presse,
That's why our organization, the House of Media, Maison de la Presse in French,
a initié des actions pouvant amener les médias à traiter des questions sociales comme celles les questions de l'infertilité et la question aussi des problèmes sociaux que les populations rencontrent.
That's why MDP has initiated programs to talk about the social problems such as infertility in the society.
Et parmi ces actions que nous menons au sein de la Maison de la Presse, il y a la formation et le renforcement des capacités des médias et des journalistes.
And among those activities that we are doing in our organization, there is also the capacity building of journalists in terms of subject related to infertility.
Il y a aussi des efforts qui sont menés pour la professionnalisation des journalistes en choisissant des secteurs particuliers pour mieux traiter l'information liée aux problèmes sociaux.
And we have also activities that aims to improve the capacity of journalists to make them more professional for treating information related to social problems.
Et d'autre part, nous encourageons et nous encadrons les radios communautaires à travailler et à communiquer à travers les langues locales pour permettre aux populations de mieux comprendre et de mieux saisir et traiter le problème.
And we also encourage journalists to talk about other subjects that take a wide range of issues in the problems that the society is facing.
Aujourd'hui, avec le développement de nouvelles technologies de l'information et de la communication, nous essayons de faire comprendre qu'aux journalistes qu'ils devront aussi être présents dans les médias sociaux pour mieux communiquer et éviter de laisser la place à la désinformation.
And nowadays, with the the new technology of information and communication, we also encourage them to use social media to reach more and more people and give them information about the subject of society so that we can reach them well.
D'autre part, nous accordons des bourses de production et d'encadrement à des journalistes pour faire des productions de qualité sur des thématiques pareilles.
And also we give them scholarship, and also we give them finance to make some reports that can give a good information to people.
Par exemple, sur la question de la migration, sur la question du diabète, sur la question aussi de l'infertilité, nous accompagnons surtout les femmes journalistes à traiter ce genre de questions et nous organisons des concours qui puissent leur permettre d'être encouragées dans les productions qu'elles fassent.
We talk about subjects such as immigration, fertility, and diabetes, and also other subjects. Also, we encourage women to be involved in those issues so that the information can go very far.
Donc, après toutes les communications, il faut retenir que il y a beaucoup de défis pour les médias africains. Il faut renforcer les capacités des médias, accompagner les journalistes à faire des productions de qualité, ne pas négliger d'utiliser les réseaux sociaux, mais aussi les langues nationales. Parce que la communication doit passer à travers les langues nationales pour mieux saisir le contenu des problèmes et mieux traiter les sujets.
So after all those theme and subject that we talk about, we should know that we have to allow journalists to use local languages, to be more involved, to use social media, and to talk about subject to make journalists more professional by improving their capacity and make them more professional to work well in their field.
Voici brièvement l'expérience que je veux partager avec vous pour permettre, pour ne pas prendre de temps, permettre à mon collègue aussi de partager son expérience.
This is briefly what I was about to say, and to allow others to talk about their subjects.
Merci, thank you.
Merci beaucoup.
Thank you very much. Good afternoon, everybody. I think after 2 days of talking about the role of the media, I think if we're in a newsroom, we'd say it's a beaten angle. This is done. But there are few things I want to bring to light here. If we're going to tell a healthy story, it has to compete with other stories for space, because media is a business. We can sit here and say, let's put this out there. It's going to occupy space in the media. It's going to compete with other stories. And I mean, we are all from the newsroom. You understand that the health story is not a sex story, but it's a story of life and death. So that's how significant it is. And on the continent of Africa, we've fallen to telling a health story from the perspective of politicians. Let's tell the health story from a perspective of professionals, because there's a lot of misinformation. The politicians will tell the health story in the context to win the next election. But the professionals will tell it to save a life. So we need to choose who we're going to stand with. I think most of what I wanted to say has been exhausted. But I want also to urge all of us that daily produce these stories to continue working our sources, continue collaborating with the people with the data. I know we've had the gaps that are there in terms of data collection on the continent, but there's always a way to tell a story. By including those people who have experienced what we're talking about here, it's more powerful than the statistics that you can lift from online publications. My president here gave us a very moving story. I think more people would listen to him than go through the statistics that you can throw at them on any particular day. So that's a better way of telling the story, by including people who have experienced it. That being said, I thank you, everybody.